Pharmacology for Midwives. Pharmacology for Midwives. 1. Pharmacology. Pharmacology. It is a Latin word meaning drug knowledge. Pharmaco equals drug. Ology equals science or knowledge. Drug is defined by the United States Food and Drug Administration as a substance or agent used in diagnosis, cure, prevention, mitigation, or treatment of a disease or condition. The FDA definition of drug also includes any substance listed in USB, the United States Pharmacopoeia and BP British Pharmacopoeia, and all substances other than food or devices capable of altering body structure. Pharmacopoeia is a book containing formulas which are standard for preparation and dispensation of drug. Branches of pharmacology. 1. Pharmacotherapeutic, clinical pharmacology. It deals with relative effect of drugs in the human system for various disorders, or it deals with the effect of a drug that the doctor orders for treating a human patient. Pharmacology for midwives. 2. 3. Pharmacokinetics, which is the study of drugs' alteration during its way through the body. It's the study of the fate of drug in the body as it is absorbed, distributed, bound to or localized in tissues, biotransformed and excreted. The science concerns itself with 1. Drug absorption and distribution. 2. Drug plasma concentration. 3. Therapeutic plasma levels. 4. Concentration of the active drug at the target site. 5. Rate of metabolism. 6. Rate of excretion. These parameters in turn affected by 1. Physiochemical nature of the drug, e.g., lipid solubility. 2. Formulation of the drug. 3. Route of administration. 4. Binding of the drug to plasma and or tissue bioavailability. 5. Individual characteristics of the patient. 6. Concomitant diseases. 7. Concomitant administration of food or other drugs. Pharmacology for midwives. 3. Complex synthesis such as sulfonamides and adrenocorticosteroids. Active constituents of plant drugs. The leaves, roots, seeds, and other parts of plants may be dried or otherwise processed for use as medicine, and they are known as crude drugs. On separation of these active constituents, the resulting pure form are 1. More potent. 2. Usually produce effects more reliable than those of the crude drugs. 3. More poisonous, and the dose must be smaller. Common drug preparations. 1. Solutions and suspensions. Aqueous solutions have one or more substance dissolved in water, e.g., epinephrine nasal sol. Aqueous suspensions are preparations of finely divided drugs, either intended for suspension or already in suspension in some suitable liquid vehicle. Sterile suspensions are intended for intramuscular or subcutaneous injections, but they can't be given intravenously. Or pharmacology for midwives. 4. 2. Dosage forms. Capsules, controlled release or sustained release capsules, tablets, pills, and troches are used to provide a drug or mixture of drugs into definite doses and avoid the inconvenience of preparing the dose from dry powder. Capsules and coated tablets are a convenient way of giving drugs that have unpleasant taste. Capsules are solid dosage form for oral use medication in a powder, liquid or oil form, are encased in gelatin shell capsule color to avoid mistakes in product identification. Tablet, powered dosage form compressed into hard discs or cylinders. In addition to primary drug, they contain binders adhesive to allow powder to stick together and disintegrates to promote tablet dissolution. Notes. 1. Some gelatin capsules and tablets may be coated with substances that resist the action of gastric juice so that will not disintegrate until they reach the alkaline secretions of the intestine. 2. Sustained release dosage forms contain small particles of the drug. Pharmacology for midwives. 5. Disposable syringes. Disposable syringes containing single doso drug preparations are widely used. Large volume intravenous solutions in glass, flexible plastic, or semi-rigid plastic, usually of 250, 500, 100 ml, e.g. 0.9% sodium chloride. Intermittent Roman 4. Solution. These solutions are similar to the IV solutions except they come in smaller volumes. 3. Additional formulations. Drops are aqueous solutions that anesthetize, pseudo-medicate eyes, ears, or nose. Installations are aqueous solution instilled into the body cavities or wound and allowed to dwell there in contact with tissue. Foams and aerosols are powders or solutions for spraying skin as topical anesthesia to soothe or protect, or inhalation for bronchodilation. 4. Others. Lotions, liquid suspensions or dispersions used for external applications, e.g., calamine lotion. Creams, aqueous and oily emulsions to soothe skin. Ointments, semi-solid preparations of medical substances in some. Pharmacology for midwives. 6. Suppositories are mixtures of drugs with a firm base that can be molded in shape suitable for insertion manually or with an applicator into body cavity or orifice, e.g. an inhaler up. NB. They should be kept cool. Drug absorption, distribution, metabolism, and excretion. Absorption is the process that involves the movement of drug molecules from the site of entry into the body to the circulating fluid. The process begins at the site of administration and is essential to the subsequent processes, distribution, metabolism, and excretion. Absorption as a process varies according to the route of administration, dosage form, and the dose of the drug. Factors affecting drug absorption. 1. Nature of the absorbing surface cell membrane through which the drug must traverse. The drug molecule may pass through a single layer of cells. Intestinal epithelium faster than several layers of cell skin. Size of the absorbing surface. NB. The more extensive the absorbing surface, the greater the absorption and more rapid effect of the drug. Pharmacology for midwives. 7. In order to be absorbed, drug must be in solution. The more soluble the drug, the more rapidly it will be absorbed. NB. Chemicals and minerals that form insoluble precipitates in the GIE, or drugs that are insoluble in water or lipids can't be absorbed. Parenterally administered drugs prepared in oily vehicle will be more slowly absorbed than drugs dissolved in water or isotonic sodium chloride. 4. Influence of pH. Drugs that are acidic, e.g. aspirin, become relatively unassociated in an acidic environment such as the stomach, and therefore can readily diffuse across the membrane into the circulation. In contrast, a basic drug tends to ionize in the stomach acid environment and not absorbed through the gastric mucosa. The reverse occurs when the drugs are in an alkaline media. NB. The unionized drug is lipid-soluble, readily diffuses across the cell membrane. The ionized drug is lipid-insoluble and non-diffusible. 5. Drug concentration. Drug administered in high concentration tend to be more rapidly absorbed than drugs administered in low concentration. Pharmacology for midwives. NB. The initial dose, temporary overloading doses of the drug are priming or loading doses, while the small daily doses are maintenance dose. Dosage form. Enteric coating on drugs are used for the following reasons. 1. To prevent decomposition of chemically sensitive drugs to gastric secretions. 2. To prevent dilution of the drug before it reaches the intestine. 3. To prevent nausea and vomiting. 4. To provide delay action of the drug. NB. Capsules forms are absorbed more rapidly than tablets because the powder inside capsules affords a large surface area than the compressed tablets. Distribution is defined as the transport of a drug in body fluids from the bloodstream to various tissues of the body and ultimately to its site of action. Most of drugs distributed initially to organs that have rich blood supply, as the heart, liver, and kidney. Delivery of the drug to the viscera, skin, and adipose tissue is slower. Pharmacology for midwives. 9. 1. Blood-brain barrier, BBB, is a special anatomic arrangement that aims to distribute only lipid-soluble drugs into the brain and CSF, e.g. general anesthesia. Ionized drugs and polysoluble in fat are not allowed to enter into the brain and CSF. Antibiotics that cross the BBB with difficulty cannot be used for CNS infections such as meningitis and encephalitis. The installation of the drug intrathecally to bypass the BBB will provide direct effect against bacterial brown infection. 2. Placental barrier, PB, is the membrane layers that separate the blood vessels of the mother and fetus. NB. Tissue enzymes in the placenta have the ability to metabolize some agents, e.g. catecholamines, by inactivating them as they travel from maternal circulation to the embryo. Unlike BBB, the non-selective passage of drugs across the placenta to the fetus is well-established fact. 2 major types of drug effects occur in the fetus. Pharmacology for midwives. Then, because of its inability to biotransform and excrete the drug given to the mother. FDA drug categories. Category A. Adequate, well-controlled studies in pregnant women have not shown an increased risk for fetal abnormalities to the fetus in any trimester of pregnancy. Category B. Animal studies have revealed no evidence of harm to the fetus, however. There are no adequate and well-controlled studies in pregnant women. Or, animal studies have shown a adverse effect, but adequate and well-controlled studies in pregnant women have failed to demonstrate a risk to the fetus in any trimester. Category C. Animal studies have shown an adverse effect and there are no adequate and well-controlled studies in pregnant women. Or, no animal studies have been conducted and there are no adequate and Pharmacology for midwives. 11. Positive evidence of human fetal risk exists, but benefits in certain situations. E.g., life-threatening situations or serious diseases may make use of the drug. Acceptable despite its risks. Category X. Adequate well-controlled or observational studies in animals or pregnant women have demonstrated positive evidence of fetal abnormalities or risks. The use of the product is contraindicated in women who are or may become pregnant. Studies in animals or humans have demonstrated fetal abnormalities, or there is evidence of fetal risk based on human experience, or both, and the risk clearly outweighs any possible benefit. Biotransformation metabolism is a process that chemically inactivates a drug by converting it to a more soluble compound on metabolites for excretion from the body. Liver is the primary site of drug metabolism, but other tissues also may be involved in this process as plasma, kidney, lungs, and the intestinal mucosa. Pharmacology for midwives. 12. Becomes more polar and more water-soluble, therefore more excretable. 2. Oxidation-reduction reaction. 3. Hydrolysis. These responses generally produce a loss in pharmacological activity, and occasionally are referred as detoxification reactions. NB. Prolonged drugs metabolism may be expected in the following cases. 1. Liver disease. 2. Renal problems. 3. Severe cardiovascular dysfunction. 4. Infant with immature metabolizing system. 5. Age with degenerative enzyme function. Cumulative drug effects may be expected when drug metabolism is delayed, which may be manifested as excessive or prolonged responses to ordinary doses of drug. Excretion is a process by which drugs and pharmacologically active or inactive metabolites are eliminated from the body, so this process decreases the pharmacology for midwives. 13. 4. Sweat and salivary glands may cause skin rashes. 5. Mammary glands transfer from mother to baby. NB. Because of renal disease, the risk of drugs accumulation and drug toxicity is increased. Note that dosage is reduced for most drugs in the presence of impaired renal function. Some drugs can't be given. Onset of action refers to the time interval between administration and notation of the first therapeutic effect. It depends on 1. The route of administration. 2. The characteristics of the drug. 3. The drug's rate of absorption through various membranes. 4. The formulation of the dose. NB. The onset of action is especially variable after oral administration, depending on the presence of food in the stomach, the motility of the GI tract, and other factors. Peak of activity. When the drug reaches its maximum effect coincides often with peak serum concentration. Many drugs cause this peak to surpass the pharmacology for midwives. 14. Duration is the period between the administration of the drug and the excretion of the entire dose of that drug or its metabolites. Bioavailability. It measures the concentration of the pharmacologically active substance at the target site in slush or in the serum. It is the function of 1. The drug itself. 2. The metabolism of the patient. 3. The rate at which the drug is liberated from its dosage form or from storage in the body. Example, many drugs bind to serum protein albumin from which they release gradually, others stored at specific site as bone tetracycline. Drug isn't to be bioavailable if 1. Bound to protein or to any other substance that makes the drug permanently or temporarily inactive. 2. Not released from its dosage form or site of administration. 3. Partially or totally degraded. Factors that influence drug dosage and action. It is important for the nurse to be oriented of the characteristic that modify pharmacology for midwives. 15. NB. Aged individuals may demonstrate different responses to drug therapy because of deterioration of hepatic and renal function, which is often accompanied by concurrent disease processes such as CVD, cardiovascular disease. True weight. The greater the weight, the greater must be the dose. However, body weight due to fat or item fluid should not be taken into consideration. For very lean and very obese individuals, drug dosage is frequently determined on the basis of drug/kg of body weight or body surface area. 3. Sex. Females don't always respond to the action of drug in the same manner as do men. Women are usually smaller than men, which lead to high drug concentration if dosage is prescribed indifferently. Females' body is composed of higher percent of adipose tissue than males. Absorption rate of drug are slower in fatty tissue than in skeletal muscle, so the effect of drug will be more pronounced. And pharmacology for midwives. 16. 4 drugs that might affect fetus and placenta should not be given during pregnancy. 4 time of administration. Drug is more rapidly absorbed when the GI it is free of food, while irritating drugs are more tolerated if there is food in stomach. Body resistant to drug is generally greater in the early morning, when the body is at its lowest point of physiologic functioning, and conversely, the body is more sensitive to drugs' effect during time of maximal activity. 5 pathologic state. Diseases alter the functional activity and accordingly its response to drug. E.g., severe pain tends to increase patients' requirement to opiates. The presence of circulatory, hepatic, or renal dysfunction will interfere with the physiologic process of drug action. 6 environmental milieu. Drugs affecting mood and behavior are particularly susceptible to the influence of the patient's environment. With such drugs, one has to consider effects in light of oral pharmacology for midwives. 17. Channels of administration. 1. The oral route PIVO. The first and most convenient method is the oral route, i.e., the patient usually swallows the drug, which then enters the gastrointestinal tract and absorbed from that area. Advantages. This route accounts for 80% of all medications administered to patients. Doctors usually decide the amount and frequency, and the patient administers the drug to himself. The cost of medication and therapy is low. Oral administration is painless and there is no necessity to practice sterile technique. Disadvantages. Inconsistent absorption from the gastrointestinal tract. Blood level may vary among different patients because of different GI characteristics, e.g., acidity, gastric motility, and intestinal mucosa. Drug irritation that causes nausea and vomiting. Unconscious patient and vomiting patients can't be given the drug. Pharmacology for midwives. 18. Eliminate the unpredictability of absorption from GIT, i.e., the amount of drug will be delivered to the patient from injection site. Medication can be given to an unconscious patient. Disadvantages. Needs sterile technique. More expensive than oral preparations. Patient usually not able to medicate himself, especially when medication needs to be injected deep into a muscle. Accidental penetration of blood vessel, especially if medication is not suitable for the administration complication. There are a number of techniques for administering drugs by injection. These are related to the target area of the injection. A. Subcutaneous injection. SC injection is administration of a drug into the subcutaneous tissues. Slowly drug absorption advantage. Disadvantages. 1. The most painful route. 2. Slow rate of absorption. 3. Not effective in emergency poor blood supply. Pharmacology for midwives. 19. A. Intramuscular route. The IM is the second most widely used route for injectable drugs, suitable for administration of both solutions and suspensions. Drugs that are very water insoluble can be given IM in an oil base. Remain for an extended period of time. Has greater vascular network than SC, so drug absorption is more quickly than SC route. Less painful, less nerve supply. The intravenous injection, IV, administering a quantity of medication through a needle into the circulation. 2 methods of intravenous injection are used. 1. Administering the drug as a bolus. 2. Continuous infusion of a drug, which is called Roman foredrip. Advantages. 1. To achieve highly accurate and quick blood level. 2. A channel to administer drugs that irritate another sites, e.g., chemotherapy. 3. Less painful during drug administration. Pharmacology for midwives. 20. 3. Thrombophlebitis from repeated injections. To minimize this phenomena but doesn't exclude it, drugs should be given IV. Drip. 4. An inadvertent intraarterial injection instead of a vein. And B. Roman 4 solutions must be completely homogeneous. No solution containing particulate matter, regardless of how fine the particle, should ever be injected Roman 4 because of the danger of creating amyloid. C. Intradermal ID and intrathecal administration. ID is a route of administration in which the drug is injected just below the epidermis. Injection is usually used for allergy test, used for TB tests and for penicillin sensitivity test. Intrathecal route of administration involves inserting a needle between 2 vertebrae and injecting the drug into the CSF. Used frequently when an anesthesiologist desires to produce a spinal block and inject local anesthetic directly into the spinal cord. Used to administer chemotherapy to prevent CNS metastasis of some types of cancers. Pharmacology for midwives. 21. Disadvantages. Erratic absorption from the rectal area result in inaccurate predicted blood level of drugs, so the dosage must be adjusted. Rectal route is ineffective when the patient suffers from diarrhea. Examples: rectal sup, used to treat hemorrhoids. Vaginal sup, used to treat vaginitis. Urethral sup, used to treat bladder conditions. Topical route are intended for use at the site of administration. There are exceptions, e.g. nitroglycerin ointment that is rubbed into the skin and systemic effect is achieved. Two topical preparations are frequently confused with each other: ointment and creams. Ointments are usually made up of a petrolatum type of base. They are quite greasy, as they are intended for prolonged contact with the skin. They don't disappear or penetrate the skin, but remain on the Pharmacology for Midwives. 22. Trade name is given by a specific pharmaceutical company. How do drugs work? In spite of a great deal of research, it is still not known how some drugs produce their effect, but it is possible to describe the way in which some of them act. 1. The receptor theory. It is believed that the cells in certain tissues contain structures called receptors. These receptors combine with substances which are produced naturally in the body. The drugs stimulate the receptors, which will cause the cells to be stimulated. The contraction of muscle fibers produced by acetylcholine is an example. The drug is thought to fit into a receptor rather as a key fits into a lock. It will then stimulate the receptor and produce an effect similar to that of the naturally occurring substance, or it may block the receptor without producing any effect but preventing any naturally occurring stimulation to happen. The blocking of acetylcholine by atropine is a good example. Pharmacology for Midwives. 23. They are very similar in structure to para-aminobenzoic acid, and certain bacteria can't distinguish between them and absorb the sulfonamide, so multiplication is stopped. 3. Enzyme inhibitors. Enzymes are substances that speed up many chemical processes within the body. Some of these enzyme-activated processes are concerned with the transport of chemicals in and out of the cells. Certain drugs have the property of inhibiting their action and thus interfere with some of these processes. Diuretics are a good example, as normally salt and water is transported out of the renal tubule back into the body, but this action requires enzymes, and if they are inhibited by a diuretic, salt and water are not reabsorbed and pass out of the kidney with a resulting diuresis. 4. Action on cell membranes. The function of nerves and muscles depends on ions passing across the membranes surrounding these cells. Certain drugs interfere with movement of these ions and thus. Pharmacology for Midwives. 24. When more is known about the processes within the cell, then more will be discovered about how do drugs work. Side effects and drug toxicity. Drug allergies. Allergic responses to drugs occur in some patients and not in others. It is an unwanted response to a drug resulting from previous exposure to that drug or one closely related to it. So drug allergy happens only after a second or subsequent exposure to the drug. Allergic reactions to drugs differ from drug toxicity in the following ways. 1. The allergic reaction occurs in only a fraction of the population, whereas toxicity will occur in all individuals if the dose is high enough. 2. The allergic response is unusual in that a small amount of unsafe drug causes a severe reaction. 3. With allergy, the reaction is different from the usual pharmacological effect of the drug. 4. For an allergic reaction to occur, the patient must have had a previous exposure to the drug or one closely related to it. Pharmacology for Midwives. 25. Example: many patients are allergic to penicillin. 2. Delayed reaction, occurring several days or even weeks after the drug has been administered. Characterized by fever, drug fever, swelling of the joints. Reaction may involve blood-forming organs and kidneys. Treatment of anaphylactic reaction may include administration of 1. Epinephrine, 2. Oxygen, 3. Antihistamines, 4. Corticosteroids. B. Drug idiosyncrasies. Idiosyncratic reactions are defined as those reactions that occur in patients who have abnormal genes which cause this abnormal response to that drug. Reaction may be excessive and unusual. Example: succinylcholine, a muscle relaxant drug, usually is broken down rapidly by enzymes in the plasma and liver so that the effects of the drug last for only a few minutes. In few patients, a normal dose of this drug produces profound muscle relaxation and suppression of pharmacology for midwives. 26. D. Drug toxicity. Excess dosage may be either accidental or intentional, results in an exaggerated response to this drug. It may be severe and may lead to respiratory depression, Cardiovascular collapse and death may occur if the drug is not withdrawn and adequate treatment is started. General side effects. Unpleasant or unwanted reaction to a drug is termed as side effects. Dermatologic reactions, pruritus, urticaria, alopecia, granulomas, rashes, photosensitivity. Blood dyscrasias. In certain patients, bone marrow is sensitive to certain drugs. This may result in the insufficient production of platelets, red blood cells, and white blood cells. NB. Patients who receive a drug that may cause bone marrow depression are monitored closely by frequent blood counts and for early signs and symptoms of infection. Some forms of blood dyscrasias. 1. Agranulocytosis, reduction in the number of granulocytes. 2. Aplastic anemia, pancytopenia, reduction of all formed elements of blood. Pharmacology for midwives. 27. CNS toxicity, loss of judgment, loss of movement coordination, loss of consciousness, convulsions, tardive dyskinesia, reduced knee, jerk reflex, drowsiness, dizziness, GI disturbance, nausea, vomiting, abdominal pain, diarrhea. Sexual dysfunction, change in libido. Drugs, orders, and prescriptions. Prescription. Medicating a patient begins when the medication is suggested and authorized by a legal prescriber, usually a licensed physician, dentist, or veterinarian. It consists of 4 parts. 1. The superscription. It includes the patient's name, address, date, and the symbol RX. The age of an infant or a child should be written to permit the pharmacist to check the correctness of the dose. 2. The inscription. It states the name of the drug, dosage form, and the amount. 3. The subscription. It contains the directions of the pharmacist, now usually limited to Pharmacology for Midwives. 28. 3. Medication name. 4. Dosage to be administered each time. 5. Route of administration. 6. Frequency of administration and special instructions. 7. Prescriber signature. Example. Name Ahmad Mohammed. Age 20 years. Address Gaza, Darfur. Date 15/1/2012 RX. Keflex 500 mg, 1 capsule every 6 hours after meal for 5 days. Signature. Types of orders. It is probably obvious that our patients are free to medicate themselves with any accessible medication. Many over-the-counter OTC drugs are available for the public without the need for a prescription. Once an individual is admitted to a clinical institution, usually neither the patient nor the nurse may legally administer any medication without a written order. Use of variant or non-standard abbreviations should be avoided because of the danger of misinterpretation. 1. Routine order. The most common type of orders. It means that the drug, as ordered, is to be regularly administered until a formal discontinuation order is written or until a specified termination date is reached. Automatic termination or stop may be explicit in agency policy, e.g. narcotic analgesics 3 days, antibiotics 5 days, steroids 7 days. Pharmacology for midwives. 29. The policies act as a stimulus to the prescriber to evaluate continued need for these drugs that require special close attention. 2. Single order. Drug is to be administered once at the time indicated, e.g. a preoperative medication atropine 0.4 mg IM on Coltor. 3. Stat order. This is a single order that a drug is to be administered immediately. Stat orders are written often for emergency when the client's condition changes suddenly. Example, give iprazoline 10 mg IM stat. 4. PRN orders. These drugs are to be administered by the nurse as necessary within the order criteria specified by the doctor or order. The decision of when to give the drug is left to the nurse's judgment. Medications to reduce the perception of pain make up the bulk of PRN orders. Keeping nursing assessment of the pain is required to carry out these PRN orders appropriately. The PQRST method is one that may be used to help the nurse in pharmacology for midwives. 30. 5. Telephone order and verbal order. Usually given in emergency and should be written in a patient's chart and is signed by the nurse who received the order and to be signed by doctor as soon as possible. Example 10. 15 Diclofenac 50 mg IM stat. Phone order Dr. Ahmed Atal at nurse Sami Mahmood. Then the nurse sings his or her name. Disadvantages. 1. Forgotten if not written at that time. 2. It is illegal until the order is signed for by the prescriber, depending on the hospital policy. 3. Can easily be miscommunicated, misinterpreted, or not clearly heard. General guidelines for handling medications. 1. When preparing or giving medicines, concentrate your whole attention on what you are doing. 2. Make certain that you have a written order for every medication you will administer. 3. Read the label before taking, while using, and returning the drug to its place. Pharmacology for midwives. 31. 8. Handling tablets, capsules, and pills properly and do not touch with fingers. Use the cap of the container to guide or from the container to the cup directly. 9. Avoid wastage of medicine. 10. Never administer medications prepared by another person, otherwise you will bear the responsibility of any mistake. 11. Some preparations as insulin, vaccines, and suppositories need to be kept in the refrigerator 2 minutes EIGHTOC. 12. Stay with the patient until he takes his medicine. 13. All mixture should be made immediately before use. 14. Never return and use drug to a sock bottle. 15. Don't add any drug to the blood. Interactions may occur without visible changes. 16. Don't use any sterile article that gets unsterile by any way. 17. Don't use clear solutions which have become cloudy or have sediment. 18. Don't use a drug that is out of date. 19. Don't use a drug that has changes its color. 20. Don't use a drug which arise doubt in mind. 21. All medicines should be kept in cupboard, narcotics in a locked. Pharmacology for midwives. 32. 25. Don't leave a tray of medicines unattended. If you are in a patient's room and must leave, take the tray with you. 26. Never chart a medicine as having been given until it has been administered. 27. Follow up the 5 rights. 1. Right patient. 2. Right drug. 3. Right dose. 4. Right route of administration. 5. Right time. Commonly used abbreviations. mg equals milligram. mcg equals microgram. Alt. Por. Equals every other hour. Im or im equals morning. mec equals milliequivalent. ml equals milliliter. ng equals nasogastric. npo equals nothing by math. bid equals 2 times a day. bun equals blood urea nitrogen. c equals with. s equals without. chf equals congestive heart failure. os equals math. cm equals centimeter. caps equals capsules. b equals before. p equals after. d equals day. dcod/c equals discontinue. dfo equals by mouth. per equals by through. dl equals deciliter. pr equals by rectum. elix equals elixir. grn equals when necessary. ggm equals gram. q equals every. Pharmacology for midwives. 33. gu equals genitourinary. qhs equals every night. hr equals hour. hs equals at bedtime. kid equals 4 times daily. cod equals every other day. Registered or art equals right. lt equals left. ib equals intravenous. im equals intramuscular. kg equals kilogram. rx equals symbol for a prescription. l equals liter. Min equals minute. sc or sq equals subcutaneous. Cert equals syrup. sl equals sublingual. Stat equals immediately. SORS equals if necessary once only. ABHA equals tablet. Sol equals solution. TID equals 3 times daily. MCG equals microgram. U equals unit. VO equals verbal order. OD equals once. Tolerance equals decreased physiologic response to the repeated administration of a drug or chemically related substances, which necessitates increase in dosage to maintain a given therapeutic effect, e.g. morphine. Dependence addiction, when the body is getting used to function in the presence of a certain drug. The body will not perform its normal functions in the absence of that drug. Substitute equals these are many different drugs which may use to treat a single disease. From these drugs, always present a drug of choice. If not available, the others are considered as the substitute. Antidote equals a drug used to antagonize the toxic effect of. Pharmacology for midwives. 34. Weights and measures. 1 kg equals 1000 gm. 1 gm equals 1000 mg. 1 mg equals 1000 mcg. 1 L equals 1000 ml. 1 teaspoonful equals about 5 ml. 1 tablespoonful equals about 15 ml. 1 ml equals 15 gtt. 1 pound lb equals 454 gram. 1 kg equals 2.2 libra lb. 1 gm equals 15 grains. Anti-infectives. Introduction. The beginning of modern medicine is generally related to 2 events. 1. The proof by Pasteur that many diseases are caused by microorganisms. 2. The discovery of effective anti-infective drugs. Sulfonamides 1938. Penicillin 1940. Pharmacology for Midwives. 35. Awareness of the problem has prompted somewhat greater scrutiny by the physician as to when and how to prescribe antibiotics. Anti-infective drugs can be divided into 1. Bacteriostatic, stop the multiplication and further development of the infectious agent. 2. Bactericidal, eradicate, kill all living microorganisms. Some anti-infectives halt the growth or eradicate many different microorganisms are termed as broad-spectrum antibiotics. Others affect only certain specific organisms and are termed narrow-spectrum antibiotics. Some of anti-infectives elicit a hypersensitivity reaction in some persons. Some penicillins cause more severe and more frequent hypersensitivity reactions than other drugs. Antibiotics equals drugs produced by microorganisms or other live organisms to kill other microorganisms. Nowadays, many are produced synthetically because of differences in susceptibility of infectious agent to Pharmacology for Midwives. 36. Vitamin K in control of fungi that may gain access to the GIT. Superinfection. Uses of anti-infectives. A. Prophylactic. 1. To protect persons exposed to a known specific organism. 2. To inhibit spread of infection from a clearly defined focus as after surgery or accidents. 3. To sterilize the bowel or other areas of the body in preparation for extensive surgery. B. Acute infections. Antibiotics are used to treat acute infections, such as tonsillitis and acute upper respiratory tract infections. Contraindication, allergy or hypersensitivity reaction. Drug considerations. Check expiration date on the container. Check for recommended method of storage and reconstitution. Clear mark the date and time of reconstitution, your initials and the strength of the solutions of all drugs. Note the length of time that the drug may be stored after dilution, and store under appropriate condition. Pharmacology for Midwives. 37. It is most effective against young, rapidly dividing organisms. Therefore, they are not used for bacteria in resting phase. They diffuse well into body tissues and fluids. They are excreted in the urine in the therapeutic concentration. They do not kill bacteria in the resting phase. Uses. 1. Gram plus B. Cocci, streptococci, meningococci, pneumococci. 2. Subacute bacterial endocarditis caused by group of streptococci. 3. Gonorrhea due to gonococci. 4. Diphtheria, tetanus, anthrax, gas, gangrene. 5. Prophylaxis for rheumatic fever. Note, not all penicillins are used for the above diseases. Specific uses are indicated for each of the individually listed drugs. Contraindications. Hypersensitivity to penicillins and cephalosporins. Side effects. Allergy, skin rashes, pruritus, wheezing, fever. Diarrhea, abdominal cramps, pain, nausea, vomiting. Membranous colitis, thrombocytopenia, leukopenia. Pharmacology for Midwives. 38. 4. Antihistamines. Dosage individualized. General nursing considerations for penicillin. 1. These antibiotics should be injected slowly to minimize local irritation. 2. IM injections are made deeply into the gluteal muscle. 3. Assess regularly for allergic reactions. If reaction occurs, the drug must be discontinued immediately. Epinephrine, Otwo. Antihistamines and corticosteroids must be immediately available. 4. Keep client who receive penicillin at outpatient clinics to stay in the clinic for at least 20 minutes after administering penicillin. 5. Don't administer long-acting types IV. They are only for IM use and don't massage after injection because rate of absorption should not be increased. 6. Take oral penicillin 1 HR before or 2-3 HR after meals. 7. Complete entire prescribed course of therapy. 1. Ampicillin. Trade name Pemberton. Class antibiotic penicillin. Notes destroyed by penicillinase lactamase enzymes. Third amino 60% absorbed from GIs after oral use. Acid resistant. Broad spectrum antibiotic. Uses is particularly recommended in respiratory, urinary and GI tract infections and other infections due to ampicillin-sensitive organisms. Pharmacology for Midwives. 39. Dosage forms. Capsules 250 mg, suspension 125 mg /5 ml, vials 250, 500, 1000 mg. Ampicillin 40 capsules 500 mg, ampicillin 40 suspension 250 mg /5 ml. Dosage POIP or IM 250 mg 500 mg Q6H adult. Children 50 mg/kg 1 day in 4 divided doses. NB for bacterial meningitis. O adults 12 m are given in divided doses 3G and Q6HR. O children up to 400 mg/kg daily in divided doses Q4HR. Specific nursing considerations. After reconstitution for IMIB administration, the solution must be used within the hour. IV administration should be given slowly within 3 minutes 5 minutes, or by infusion. 2-enoxacillin. Trade name Moxipin, Moxipharm, Amxitid. Class antibiotic penicillin. Notes inactivated by penicillinase, including those produced by Staphylococcus aureus and gram-negative bacilli. Acid stable. It a broad-spectrum antibiotic. Absorbed well from the GIT. Pharmacology for midwives. 40. Skin infections. Gonorrhea. Dosage forms. Hats. 250 mg, suspension 125 mg/5 ml. Moxipin 40 caps. 500 mg, Moxipin 40 suspension 250 mg/5 ml. Dosage 250 minus 500 mg Q8HR. Specific nursing consideration. Reconstituted suspension is stable for 1 week at room temperature and for 2 weeks at 2 EIGHTO centigrade degrees. 3-amoxicillin and potassium clavulanate. Trade name Augmentin. Class antibiotic penicillin. Note, potassium clavulanate inactivates beta-lactamase enzymes, which are responsible for resistance to penicillin. Dose tablets or suspension 250 minus 500 mg Q8HR. 4-cloxacillin. Trade name Orbanin. Class antibiotic penicillin. NB more resistant to penicillinase than is penicillin G. Uses infections caused by penicillinase producing staphylococci, streptococci, pneumococci, osteomyelitis, infected wounds and burns. Pharmacology for midwives. 41. Syrup 125 mg/5 ml 250 mg/5 ml. Dose. Adult 250-500 mg Q6HR. Children 50 mg/kg per day in 4 divided doses. Nursing considerations. Administer on an empty stomach. Refrigerate reconstituted solution and discard remaining amount. After 14 days. NB. To prepare oral suspension, add amount of water stated on label and shake well. Shake the bottle well before each use. 5-penicillin G, benzathine and procaine combined. Trade name Bacillin CR. Duplo-penicillin, procaine benzyl. Penicillin. Class antibiotic penicillin. Uses streptococcal infections without bacteremia of 1. Upper respiratory tract such as tonsillitis, pharyngitis. 2. Otitis media. 3. Skin and soft tissue infections. 4. Scarlet fever. 5. Acute glomerulonephritis. 6. Gonorrhea and syphilis. Pharmacology for midwives. 42. NB. Penicillin G is inherently rapid in action while procaine. Penicillin G provides penicillin G in a prolonged action form. Contraindications: hypersensitivity to penicillin. Side effects: nausea, vomiting, stomatitis, skin rash, anaphylaxis. Dosage IM only. Adult 1,200,000 2,400,000 units 10 days for streptococcal infection. Pediatric 600,000 1,200,000 units. Nursing considerations. Shake multiple dose vial vigorously before withdrawing the desired dose. Use a 20-gauge needle and don't allow medication to remain in the syringe and needle for long periods of time before administration, because the needle may become plugged and the syringe frozen. Inject slowly into the muscle and don't massage the injection site. Before injection of medication, aspirate needle to ascertain that needle is not in a vein. Rotate site of injections. Don't administer Roman 4. Pharmacology for midwives. 43. NB. The low cost of penicillin G still makes it the first choice for treatment of many infections. Rapid onset makes it especially suitable for fulminating infections. Destroyed by acid and penicillinase. At side effects. Rapid IV administration may cause hyperkalemia and cardiac arrhythmias. Thrombophlebitis, so assess the site of administration for administering each dose. Uses: infections due to penicillin-sensitive organisms. NB. Penicillin G potassium is indicated as an alternative to penicillin G sodium in those patients in whom intake of sodium Must be restricted. Contraindications: hypersensitivity. Dosage forms: penicillin G potassium injection vial of 1 mu and penicillin G sodium vials of 15 mu. Dosage IM continuous IV infusion 300,000 30 million unit, depending on the use. Pediatric 100,000 250,000 units /kg daily in divided dose. Oral solution /tabs adult 200,000 500,000 unit Q6 minus 8 HR. Pediatric 25,000 90,000 units /kg daily in divided doses. Note: 250 mg of oral sol equals 400,000 units of injection. Solution. Pharmacology for midwives. 44. Monitor intake and output NL. Solution may be stored at room temperature for 24 HR or in refrigerator for 1 week. Use 1% 2% lidocaine as a diluent for IM, used to decrease pain at injection site. Note: the penicillin G should not be mixed during IV administration with the following drugs: aminophylline, gentamicin, heparin, vancomycin, and sodium bicarbonate. Cephalosporins are semisynthetic antibiotics that resemble the penicillins both chemically and pharmacologically. Are absorbed rapidly from the GI tract and quickly reach effective concentrations in the urinary, GI, and respiratory tracts except in patients with pernicious anemia or obstructive jaundice, and eliminated rapidly in patients with normal renal function. They are broad-spectrum antibiotics that have been classified as first, second, and third generation drugs. The difference among generations is based on antibacterial spectra. Third generation cephalosporins have more activity against gram-negative organisms and resistant organisms and less activity against gram-positive organisms than first generation drugs. They are also stable against beta-lactamase enzymes. The cost increases from first to third generation cephalosporins. Action: they interfere with the final step in the formation of the bacterial cell wall, resulting in unstable cell membranes. That Pharmacology for midwives. 45. NB. First and second generation drugs don't enter the CSF well, but third generation drugs enter inflamed meninges readily. Cephalosporins are excreted rapidly by the kidneys. Uses: they are effective against infections of 1. biliary tract, 2. BI tract, 3. GU tract, 4. bones and joints, 5. upper and lower respiratory tract, 6. skin, 7. meningitis, 8. osteomyelitis, 9. peritonitis, 10. arthritis media, 11. gonorrhea, 12. prophylaxis prior to surgery. Contraindications: hypersensitivity to cephalosporins or penicillin, renal failure, pregnancy, lactation. Side effects. Pharmacology for midwives. 46. Therapy should be continued for at least 2-3 days after symptoms of infection have disappeared. Assess client with a history of hypersensitivity reaction. 4. Penicillin or cephalosporins. Assess client financial status. These drugs are usually expensive. If GI upset occurs, administer drugs with meals. Should be administered on empty stomach. Obtain liver and renal studies. Examples: 1. Cefalexin monohydrate. Trade names: Keflex, Geflex. Plus. Antibiotic: cephalosporin first generation. Uses: infections of respiratory tract, skin, bones, and GU. Additional side effects: nephrotoxicity, jaundice. Dosage: caps. Suspension tab. 250 minus 500 mg Q6HR. 2. Cephalothin sodium. Trade name: Keflin. Class: antibiotic, cephalosporin first generation. NB. Poorly absorbed from GI tract and must be given. Pharmacology for midwives. 47. Uses: otitis media, infections of upper and lower respiratory tract. UTI and skin infections. Dosage: capsules, oral suspension. 250 mg every 8 HR and may be doubled in case of severe infection for adults. Children 20 mg/kg/day in 3 divided doses. Specific drug considerations: the suspension should be refrigerated after reconstitution and discarded after 2 weeks. 4. Cefuroxime sodium. Trade names: tenofovir. Class: antibiotic, cephalosporin second generation. Uses: PO, pharyngitis, tonsillitis, UD, bronchitis, IM or IB. Pneumonia, UD, osteomyelitis, meningitis, septicemia, pre-op. Prophylaxis. Side effects: decrease in HB and HCT hematocrit. Dosage: tablets 250 minus 500 mg Q12 HR adult. 125 mg BID children. IMIP 750 mg Q8HR. Severe infection 1.5 GQ6-8HR. Pharmacology for midwives 40A. Dosage oral suspension tablets. Adults either 400 mg once daily or 200 mg every 12 HR. Children 8 mg/kg/day. Specific drug consideration. Once reconstituted, the suspension should be kept at a room temp, where it maintains potency for 14 days. Therapy should be taken once a day at the same time each day. 6. Cefotaxime sodium. Trade name Claforn. Classification antibiotic cephalosporin 3rd generation. NB. Treatment should be continued for a minimum of 10 days for group beta hemolytic streptococcal infections to minimize the risk of glomerulonephritis or rheumatic fever. The IV route is preferable for patients with severe or life-threatening infections. Uses: pneumonia, GU tract infections, meningitis, peritonitis, septicemia, pelvic cellulitis, endometritis. NB used with aminoglycosides when causative agent has not been identified. Dosage IM 1 gm Q12HR adult. Pharmacology for midwives 49. 7. Ceftriaxone sodium. Trade name Rosvin. Class cephalosporin 3rd generation antibiotic. Uses: pneumonia, UD, infections of skin, bone and abdomen, meningitis, bacterial septicemia pre-op. Prophylaxis. Dosage IM adult 1 minute daily in single or divided doses every 12 HR. Or pediatric 50 minutes 75 mg/kg/day other than meningitis 100 mg/kg 1 day. Drug considerations. OIM injection should be deep into the body of large muscle. OIV injection should be diluted. O for stability of solution, the package insert should be checked carefully. O dosage should be maintained for at least 2 days after symptoms of infection have disappeared. Usual course is 4 minutes 14 days. Aminoglycosides are broad-spectrum antibiotics primarily used for the treatment of serious gram-negative infection caused by Pseudomonas E. coli. Pharmacology for midwives 50. Action. They are believed to inhibit protein synthesis by binding irreversibly to ribosome, which leads to production of non-functional protein. They are usually bactericidal as a result of disruption of bacterial cytoplasmic membrane. They are poorly absorbed from the GI tract, therefore are usually administered parenterally, not orally. Uses: gram-negative bacteria causing 1 bone and joint infections, 2 respiratory tract infections, 3 septicemia including neonatal sepsis, 4 urinary tract infection UAT, 5 post-operative infections, 6 intra-abdominal infections as peritonitis, 7 skin infections including burns. NB, it should be used for gram-plus-V bacteria only when other less toxic drugs either ineffective or contraindicated. Contraindications. Pharmacology for midwives 51. 3. Neurotoxicity, headache, tremor, lethargy, numbness, burning of face. 4. Others: nausea, vomiting, skin rash and superinfection. Drug interactions. Vancomycin additive, ototoxicity and nephrotoxicity. Penicillin decreased the effect of aminoglycosides. Drug considerations. Assess history of hypersensitivity. See anti-infectives. IM administration: inject deep into muscle to minimize pain. Administer for only 7 minutes 10 days. Obtain laboratory studies for renal function. Continue to monitor for ototoxicity. Discuss with the client/family the importance of taking medications at the appropriate prescribed time intervals. Examples: 1. Amikacin sulfate. Trade name Amikin. Classification: antibiotic, aminoglycoside. Pharmacology for midwives 52. Dose: adults 3 mg/kg/day divided into equal 3 doses Q8HRS Roman 4. Warm. NB, it is the drug of choice for hospital-acquired gram-negative sepsis including neonatal sepsis, serious staphylococcal infections. Side effects: alopecia, CNS, ototoxicity, neurotoxicity, tinnitus, dizziness, ringing in the ears, vertigo. GI, nausea, vomiting, anorexia, weight loss, increased salivation. CV, palpitation, hypotension or hypertension. Hematologic, decreased number of blood cells. Q, nephrotoxicity, local pain and irritation at IM injection site. Formulation: vial 2 ml containing 20 mg, ampoule 2 ml containing 80 mg. Dosage IM usual. IV, adults 3 mg/kg Q8HR up to 5 mg/kg daily. Pharmacology for Midwives. 53. Dilute dose when given Roman 4. Monitor for kidney function test BUN and creatinine, complete. Blood count when used for more than 7 days. Consult with doct. Accordingly. Chloramphenicol. Trade names chloromycin, synthamycin. NB, it can be extremely toxic due to protein synthesis inhibition in rapidly proliferating cells as bone marrow and should not be used for simple infections. Available for hospital use only. Action: inhibits protein synthesis in bacteria by binding to ribosomes. The drug is mostly bacteriostatic, bactericidal, and high doses, well absorbed from the GI tract and distributed to all parts of the body including CSF. Uses indications. ONB, not to be used for trivial infections as prophylaxis of infection, cold throat infections or flu. O treatment of choice for typhoid fever, not for carrier state. O meningitis due to Haemophilus influenza, pneumococcus or pharmacology for midwives. 54. O renal and hepatic failure. Side effects. Aplastic anemia, pancytopenia, nausea, vomiting, abdominal distension, progressive pallid cyanosis, ashen gray color. Tachypnea, vasomotor collapse and death, Gray syndrome in infants, superinfections. Drug interactions. O-acetaminophen increases the effect of CHL-pramphenical, increases serum levels. O-oral anticoagulants, increases the effect of anticoagulant, decreases its breakdown by the liver. Formulation: tablets 250 mg, vial 1. Dosage: 50 mg/kg daily in 4 divided doses Q6 of 500 mg to 1 gm Q6HR. Drug considerations. O administer IB as 10% solution over at least 1 min. O note any history of hypersensitivity and other contraindications. And if client takes antidiabetic or other medications that cause bone marrow depression. Pharmacology for midwives. 55. Erythromycin. Action: inhibits protein synthesis of microorganisms by binding to ribosome. It is effective only against rapidly multiplying organisms. Absorbed well from the upper GI small intestine. Are manufactured in enteric-coated or film-coated forms to prevent destruction by gastric acid, diffuse poorly to CSF, and primarily excreted in bile. Uses. O the drug of choice to treat respiratory tract infections. O intestinal amoebiasis. O an alternative drug to treat the following conditions in patients who are allergic to penicillin. Infections due to group beta hemolytic streptococci. To prevent bacterial endocarditis prior to dental procedures. Venereal disease, gonorrhea or syphilis. Conjunctivitis of the newborn. Long-term prophylaxis in rheumatic fever. Contraindication: hypersensitivity. Side effects. O nausea, vomiting, diarrhea, skin rashes, hepatotoxicity. Confusion. Pharmacology for midwives. 56. Formulation: tablets 250 mg, suspension 125 mg, 200 mg, 400 mg. Dosage. O the usual adult dose is 250 mg Q6HR, can be doubled in severe infections. O children, thirdamin is 50 mg/kg in divided doses. Drug consideration. O should be taken on an empty stomach. O in the treatment of streptococcal infections should be administered for at least 10 days. O don't administer with fruit juice or other acidic drinks, because it may decrease the activity of the drug. Miscellaneous antibiotics. 1. Vancomycin hydrochloride. Trade name Vancomycin. Class: antibiotic miscellaneous. Action: it appears to bind to bacterial cell wall, arresting its synthesis and lysing the cytoplasmic membrane by a mechanism that is different from that of penicillin. It is bactericidal for most. Pharmacology for midwives. 57. O endocarditis. Osteostomolitis. O pneumonia. Septicemia. Oral administration is useful in treatment of O enterocolitis. Pseudomembranous colitis. Contraindications. Hypersensitivity. Minor infectious. Side effects. Ototoxicity, deafness. Nephrotoxicity, uremia. Red neck syndrome, chills, arrhythmia of neck and back fever. Skin rashes, drug, fever. Hypotension due to rapid administration. Thrombophlebitis at site of injection. Drug interactions. Never give with other off-toxic or nephrotoxic agents, especially aminoglycosides. Dosage: caps. Syrup, or IB, 0.5 GQ6HR or 1Q12HR. Drug considerations. Mixes indicated on package insert. Intermittent infusion is the preferred route. Avoid rapid IV administration, nausea and hypertension. Avoid extravasation during injections. Pharmacology for midwives. 58. Action is broad-spectrum bactericidal activity, inhibits the synthesis of bacterial DNA by inhibiting the enzyme DNA gyrase. Uses. Uret infectious diarrhea. Infection of lower respiratory tract, bone, joints and skin. Contraindications. Hypersensitivity. Children lactation. Side effects. Nausea, vomiting, dysphagia, crystalluria, hematuria. Rashes, bad taste, GI bleeding, headache, insomnia. Dosage 250 minutes 500 and GQ12HR for 7 minutes 14 days. Drug considerations. Give medication 2HR after meals. Stress importance of drinking increased amounts of fluids too. Keep urine acidic and to minimize the risk of crystalluria. Tetracyclines. Action. The tetracyclines inhibit protein synthesis of microorganisms by binding to its ribosomes, thereby interfering with protein synthesis. The drugs are mostly bacteriostatic and are effective only against multiplying bacteria. Pharmacology for midwives. 59. Uses. NB. Due to development of resistance, they are usually not used for infections by common Gram+V and Gram-V organisms. They are the drugs of choice for rickettsial infections, as 1. Rocky Mountain spotted fever. 2. Endemic typhus. Urethritis due to mycoplasma. Prophylaxis of plague after exposure. Adjunct treatment of trachoma and acute intestinal amoebiasis. They are the drug of choice for Gram-V bacteria, causing 1. Cholera. 2. Brucellosis. Alternative treatment to penicillin for uncomplicated gonorrhea, vaginitis, severe acne. Pharmacology for midwives. 60. Side effects most common. Nausea, vomiting, thirst, diarrhea, flatulence, sore throat and anorexia. Black hairy tongue, esophageal ulcer. Skin rashes. Photosensitivity. Discoloration of nails, infants and children's teeth. Delayed bone growth. IB. Use may cause thrombophlebitis. NB. The administration of deteriorated tetracyclines may result in Fanconi-like syndrome characterized by nausea, vomiting, acidosis, proteinuria, hypokalemia, polyuria, and polydipsia. Nursing considerations. Don't use outdated or deteriorated drugs. Discard unused. Medications. Administer IM deeply in large muscle mass. Administer on an empty stomach 1 hour before or 2 HR after meals. Pharmacology for midwives. 61. 2. Chlortetracycline HCl phalmic and topical 3% unaffected. Area 1-5 times daily. 4. Doxycycline. Trade names: Doxylin, Doxapol, Doxapharm, Doxycycline. Class: antibiotic tetracycline. Dosage form: caps. Film coated tab. 100 mg. Dose: the usual dose for adults. Our first day 100 mg Q12 are followed by 1 tab. Daily. In severe cases, 1 tablets daily in divided doses Q12 HR. Side effects: nausea, vomiting, diarrhea, headache, hypertension, colitis, hemolytic anemia. Nursing consideration. Do not give with antacid, milk, or any product that contains calcium, zinc, aluminum, magnesium, and ferrous salts because these products decrease the absorption of the drug. 4. Oxytetracycline. Pharmacology for midwives. 62. Sulfonamides. Bacteria need paraminobenzoic acid dihydrofolic acid to multiply. Action: sulfonamides are structurally related to paraminobenzoic acid. The bacteria take it instead of these acids. So, tetrahydrofolic acid is not formed, which is necessary for synthesis of DNA. Therefore, there will be no cell multiplication. Bacteriostatic, not bactericidal. Relatively inexpensive drugs. Excreted mainly via kidneys. Uses: less useful because of bacterial resistance and development of other antibiotics. UDE, E. coli, Proteus, and staph aureus. Cephalosporins are given now to eliminate meningococci from nasopharynx carriers. As alternative to penicillin for prophylaxis from rheumatic fever. As alternative to tetracycline in treatment of chlamydia. Pharmacology for midwives. 63. Side effects. nausea, vomiting, stomatitis, abdominal pain, headache, dizziness, ataxia, photosensitivity, rash, Stevens-Johnson syndrome, rhinitis, conjunctivitis, fever, stomatitis and rash, renal damage, crystalluria, hematuria, proteinuria, hemolytic anemia, aplastic anemia, jaundice, superinfection. Note: vitamin K should be administered to patient take long-term. Sulfonamide since it kills normal flora. Nursing consideration. Obtain a complete nursing and drug history. If the client is pregnant, the physician should be informed so that another type of medication not harmful to a developing fetus may be used. During drug therapy, assess client for any of the following reactions that may require withdrawal of the drugs. Skin rashes, abdominal pain, and anorexia. Pharmacology for midwives. 64. Monitor intake and output. 1 silver sulfadazine, silvadine, silverol cream. Uses: topically for prevention and treatment of sepsis in 2nd and 3rd degree burns, minor bacterial skin infections, and dermal ulcers. Dosage: once or twice daily topically by sterile gloves over a clean or debrided burn. Contraindications: pregnancy, lactation, infant below 2 months. 2-sulfamethoxazole and trimethoprim. Trade name: Risprim, Septrin, Pathoprim, Bactyl, Septin, Voltrezept. Dosage forms: oral suspension, sulfamethoxazole 200 mg plus trimethoprim 40 mg /5 ml. Tablets: sulfamethoxazole 400 mg and trimethoprim80/tab. Double strength tab. 4-day sulfamethoxazole 800 mg plus trimethoprim 160 mg /tab. Pharmacology for midwives. 65. Urinary germicides /analgesics. UTI may be treated with one of the sulfonamides, antibiotic, or drugs discussed in this chapter. 1-nalidixic acid, negram, urogram quinolone. Class: urinary germicide. Action: inhibit DNA synthesis of the microorganism. Partially metabolized in the liver and rapidly excreted in urine. Sensitivity determination is recommended. Liver and kidney functions test if used more than 2 weeks. Uses: acute and chronic UTI. Contraindications: to be administered with caution in patients with liver disease, impaired kidney function, epilepsy, pregnancy, lactation, children, cerebral arteriosclerosis. Pharmacology for midwives. 66. Bacteriostatic at low concentration, bactericidal at high concentration. Uses: severe UTI, pyelonephritis, cystitis. Contraindications: anuria, oliguria, impaired renal function. Pregnancy, lactation, infant less than 1 month of age. Special concerns: use with caution in patients with anemia, DM, electrolyte imbalance, avitaminosis, debilitating disease. Side effect: nausea, vomiting, pancreatitis, abdominal pain, leukopenia, megaloblastic anemia, headache, vertigo, hemolytic anemia in patients with G-6PD deficiency. 4-norfloxacin, apeiroquinolone. Class: urinary germicide. Action: against gram-positive and gram-negative organisms by inhibiting DNA synthesis. Not effective against obligate anaerobes. Uses: complicated and uncomplicated UTI. Contraindications: hypersensitivity to negram, lactation, children. Side effects: nausea, vomiting, heartburn, abdominal pain, leukopenia. Dose: tabs. 400 mg bid for 7 minutes 10 days. Pharmacology for midwives. 67. Side effects: hemolytic anemia, G6PD, nephrotoxicity, hepatotoxicity, nausea, yellow-brownish discoloration of urine. Note: yellow discoloration of skin and sclera indicates accumulation as a result of renal insufficiency. Dose: 200 mg d with or after meal. Treatment of overdose: methylene blue Roman 4 or ascorbic acid PL. Nursing consideration: inform patient that drug may turn urine color into deep yellow or orange color. Renal function test is necessary to avoid toxicity. Encourage fluid intake. Antifungal agents. Several types of fungi or yeasts are pathogenic for humans. Fungal infections may be systemic, limited to skin, hair, or nails, or affect most mucous membranes including the GI tract and vagina. Candida organisms belong to this group. Drug therapy depends both on the infectious agent and on the type of infection. An accurate diagnosis of the infection before therapy is most. Pharmacology for midwives. 68. Action: it is natural antifungal antibiotic that is derived from Streptomyces nursae and both fungostatic and fungicidal against all Species of Candida. It binds to fungal cell membrane sterols, resulting in altered cellular membrane permeability and leakage of potassium and other essential components. It is excreted in feces. Uses: Candida infections of the skin, mucous membranes, GI tract, vagina and mouth thrush. NB. The drug is too toxic for systemic infections, although it can be given PO for intestinal mononucleosis infections, as it is not absorbed from the GI tract. Side effects: has few toxic effects such as nausea, vomiting, diarrhea. Dosage forms: suspension contains 100,000 units / ml 12 ml bottle with VOPA. Ointment contains 100,000 units / G15G tube. Vaginal tab contains 100,000 units. Dosage. Pharmacology for midwives. 69. Apply cream/ointment with a swab. Instruct client to keep medication in mouth as long as possible before swallowing. Insert vaginal tab. High in vagina with an applicator. Treatment should be continued for at least 48 HR after clinical cure has been achieved to prevent relapse. 2. Miconazole. Trade name Dectarin. Class: antifungal agent. Actions: as nystatin. It also inhibits biosynthesis of triglycerides and phospholipids and also inhibits oxidative enzyme activity. Uses: systemic fungal infection, e.g. mucocutaneous candidiasis, skin, nail and hair infections. Tinea pedis, athlete's foot, tinea corporis. Oral thrush oral gel. Against some gram-plus V bacteria. Contraindication: hypersensitivity. Side effects: topical skin rashes, headache, burning, irritation. Systemic: nausea, vomiting, diarrhea, anorexia, fever. Thrombocytopenia. Dosage forms: Pharmacology for midwives. 70. Dosage: IV 303,600 mg/day in divided doses. Topical: apply to cover affected areas in morning and evening. Vaginal cream /sup. 1 sup. Daily at bedtime for 7 days. Anthelmintics. Ailments: worms may infest the intestinal mucosa of lumen and can migrate to a particular tissue. Treatment of worms infection is complicated since a worm may have one or more morphological stages. All family members should be examined since infestations are transmitted by sharing bathrooms. Hygiene is very important. Worms divided into 3 groups. A. Cestodes. Tapeworm, e.g. Taenia saginata beef, Taenia solium pork. B. Nematodes. 1. Filariasis. 2. Hookworm, Ancylostoma. 3. Pinworm, Oxyureosis, common in school age. 4. Roundworm, Ascaris, can cause GI and respiratory obstruction. 5. Threadworm, Strongyloid. 6. Whipworm. C. Trematodes, Bilharziosis. Nursing considerations: instruct responsible family member how to prevent infestation with pinworm by washing hands after toiling plus before meals. Pharmacology for midwives. 71. Keep nails short. Applying antipyretic ointment to anal area to reduce scratching, which transfers pinworms. Alert all family members to be examined for pinworms. Emphasize the need for follow-up examinations to check the results of treatment. 1. Mebendazole, Veramox. Class: anthelmintic. Action: by blocking the glucose uptake of the organism, which leads to worm death. Uses: whipworm, pinworm, roundworm. Contraindications: hypersensitivity. Special concerns: pregnancy, children less than 2 years. Side effects: transient abdominal pain, diarrhea. Dosage: for pinworm 1 tablet 1 time. Whipworm, roundworm, hookworm 1 tablet in the morning and evening on 3 consecutive days. Note: all treatments can be repeated after 2-3 weeks. 2. Piperazine, Veramazine. Pharmacology for midwives. 72. Contraindications: impaired liver and kidney function, seizures, and hypersensitivity. Side effects: nausea, vomiting, diarrhea, tremors, ataxia. Blurring of vision, cataract, bronchospasm, rash. Ambicide and trichomonocytes. 1. Metronidazole, Flagyl. Class: systemic trichomonocyte, ambicide. Action: effective against anaerobic bacteria and protozoa. Inhibit growth of trichomona and ambi by binding to DNA, and inhibit nucleic acid synthesis, resulting in cell death. Well absorbed from GI and widely distributed in tissues. Eliminated in urine primarily, 20% and change, resulting in red-brown discoloration in urine following PO or IB. Uses: a systemic. 1. Amoebiasis, trichomoniasis. 2. Aim at dysentery. Pharmacology for midwives. 73. Contraindications. Active organic disease of CNS. Blood disorders. Lactation. First trimester of pregnancy. Topical hypersensitivity. Side effects: dry mouth, metallic taste, diarrhea, dizziness, abdominal discomfort, furry tongue, ataxia, vertigo, and leukopenia. Dose 500 minutes 750 mg 3 times daily for 5 minutes 10 days. Nursing considerations. If used Roman IV, drug should not be given by Roman IV bolus. If a primary Roman IV fluid setup is used, discontinue the primary. Solution during infusion of metronidazole. Report any symptoms of CNS toxicity immediately, e.g. ataxia or tremor, which necessitate withdrawal of drug. The drug may turn urine brown. Explain for the male partner the necessity of therapy. 2. Povidone iodine, betadine. Class antiseptic, germicide. Pharmacology for midwives. 74. Degerming of skin. Preoperatively. Treatment of dandruff. Contraindications: skin hypersensitivity. Dose: 1 full-strength solution or ointment only once. Antiviral drugs. Most antibiotics are ineffective against viruses. Vaccines have been widely used to prevent certain viral infections, e.g. measles, smallpox, polio. Treatment of AIDS. 1 acyclovir, Solverax. Plus. Antiviral, anti-infective. Action: drug is converted to acyclovir triphosphate, which interferes with herpes simplex virus DNA polymerase and therefore inhibit DNA replication. Uses: P.O. for initial and recurrent herpes infection in immunocompromised and non-immunocompromised patients. Parenteral, initial therapy of severe genital herpes, varicella zoster. Pharmacology for midwives. 75. Topical burning pain. Dose: O-caps. Untabs, initial 200 mg/4 for a total of 5 caps/day for 10 days. Ochronic, 200 mg TID for up to 12 months. 2 amantadine, simitol. Plus antiviral, antiparkinson. Action: prevent penetration of the virus into cell, maybe by preventing uncoating of RNA. Uses: influenza viral infection. Symptomatic treatment of idiopathic Parkinson. Parkinsonism syndrome postencephalitis. Contraindications: hypersensitivity. Side effects: nausea, vomiting, constipation, anorexia, CHF, leukopenia. Antineoplastic agents. Treatment of tumors involves one or a combination of the following. Treatment modalities. 1. Surgery. Pharmacology for midwives. 76. Rapidly growing cells, e.g. bone marrow, GI mucosal epithelium, and hair follicles. Side effects: bone marrow depression, leukopenia, thrombocytopenia, anemia. Hair follicles, alopecia. GI, nausea, vomiting, stomatitis. General nursing considerations for antineoplastic agents. Administration: O should be prepared by trained personnel, not by a pregnant. O prepared away from cooling or heating vents and other people. O use latex gloves to protect skin. O wash hands before and after preparation. O wear non-permeable surgical gown with a closed front fit. Knit cuffs. O use piggyback setup with electronic infusion pump. O start infusion with solution not containing vesicant agent. O if possible, not use dorsum of the hand, wrist and antecubital fossa as a site of infusion and don't previously used sites. O after starting a medicated solution, check for blood return. Pharmacology for midwives. 77. Bone marrow depression. 1. Leukopenia. Or check WBC count and sudden drop less than 2000/m3. Or check temperature every 4 hours, report fever more than 30 EIGHTOC. O assess skin and body orifices for signs of infections. O prevent infection by meticulous body care and strict medical asepsis. O provide mouth care every 4 minutes 6 hours. O reverse isolation. Private room. Gloves, masks, gowns as ordered. Limit articles brought to room. Infected personnel, staff and visitors not to enter this room. O change Roman IV infusion every 24 hours, Roman IV site every 48 hours. 2. Thrombocytopenia. O check platelet count less than 150,000/m3. O check urine for blood cells, stool for occult blood, skin for. Pharmacology for midwives. 78. O provide nutritious diet. O instruct client to take iron and vitamin C supplements. O assist with blood transfusion. 4. GI toxicity, nausea, and vomiting. O compare client's nutritional status and weight with baseline. Established at starting of therapy. O. Determine if the client has anorexia. O. Premedicating with antiemetic is ordered. O. Administering antineoplastics on empty stomach to minimize nausea and vomiting. O. Encourage ingestion of dry carbohydrates such as toast before therapy. O. Consider likes and dislikes of the patient. O. Encourage intake of high-protein diet. O. Provide good oral hygiene both before and after meals. O. Provide supportive care to keep client comfortable and clean and free from odors. O. Correction of electrolytes may be required. Alkylating agents. Pharmacology for midwives. 79. 2. Cyclophosphamide CYC cytoxin. Class antineoplastic alkylating agent. Uses multiple myeloma, malignant lymphomas, Hodgkin's disease. Additional side effects: alopecia, bone marrow depression, hemolytic cystitis, darkening of skin and fingernails. Ifosfamide (LFX). TUS. Antineoplastic alkylating agent. Uses acute leukemia, testicular cancer, malignant lymphomas. Additional side effects: hemorrhagic cystitis. Antimetabolites. Action: disrupt DNA replication by interfering with an essential step in its synthesis and metabolism. 1. Cytarbine, cytosar. Class antineoplastic antimetabolite. Uses acute myelocytic leukemia, Hodgkin's lymphoma. Additional side effects: cytarbine syndrome occurs 6-12 hours. Following administration manifested by myalgia, fever, and bone pain. 2. Methotrexate MTX Avaxate. Pharmacology for midwives. 8. Side effects: severe bone marrow depression, hepatotoxicity, hemorrhagic enteritis, transient paresis or seizures. Given intravenously and intrathecally. C. Antibiotics. Action: interfere with RNA, DNA, and protein synthesis. 1. Limicin. 2. Daptonomycin, actinomycin D. 3. Doxorubicin, adriamycin. Denatural products and miscellaneous agents. 1. Cisplatin. Plus. Antineoplastic, miscellaneous. Side effect: severe nausea and vomiting. Note: hydrate patient by IV fluids 8-12 hours before treatment. Sulfur and antiemetic is to be given to relieve nausea and vomiting. 2. Vincristine, oncovin. Class antineoplastic, miscellaneous, plan alkaloid. Uses Hodgkin's disease, leukemia, lymphoma Roman 4 only. Hormonal and antihormonal antineoplastic agents. The growth of cancers affecting the male or female reproductive system and the breast is usually enhanced by the presence of hormones normally controlling the function of these tissues. Administration of an antihormone or different hormone which alters hormone function by competing for hormone receptors, which will inhibit neoplastic growth. Specific nursing consideration. Pharmacology for midwives. 81. Assess for insomnia, anorexia, vascular collapse symptoms of hypercalcemia. Withhold drug and report elevated serum calcium level. 1. Diethylstilbestrol, stilbestrol. Plus. Estrogen, synthetic, non-steroidal. Action: compete with androgen receptor. Uses: contraceptive emergency, prostatic cancer palliative. Contraindication: O. Breast cancer, thrombophlebitis. O. During pregnancy, possible vaginal cancer. 2. Tamoxifen, Valodex. Class anti-estrogen. Action: occupy estrogen receptors in target tissue breasts. Uses: palliative treatment of breast cancer postmenopausal. Gynecomastia to reduce pain and size. 3. Testosterone, testosterone. Plus. Antineoplastic, androgen. Action: synthetic steroid related to testosterone. Pharmacology for midwives. 82. Iron deficiency, anemia, hyperchromic microcytic. Vitamin C citrus foods enhances absorption of iron. Megaloblastic anemia, vitamin B12 and folic acid deficiency. Iron preparations. The complex of iron and other substances are normally taken orally, sometimes administered peritorally when have some disorders limiting the amount of drug absorbed by GIT. Our patient is unable to tolerate oral iron. Iron deficiency is common in infants' low iron in diet, and during pregnancy increased requirements. Action: iron diet or drug absorbed from GIT and transport to bone marrow after combining with protein transferrin. 2. Incorporate with hemoglobin. Uses: prophylaxis and treatment of iron deficiency anemia. Contraindications: hemosiderosis, peptic ulcer, enteritis, ulcerative colitis, and liver cirrhosis. Drug interactions. O. Antacids, decrease absorption of iron. Pharmacology for midwives. 83. Treatment of iron toxicity. O. Symptomatic treatment. Induce vomiting, then give egg and milk. Gastric lavage may be done with Roman 408 Gotti solution 2. Counteract acidosis. O. Give antidote chelating agent, Roman 4 infusion of tefuroxamine. Tisferal. Nursing considerations. O. Take a complete history, including use of antacids. O. Ask about any evidence of GI bleeding. O. Advise client to take iron with meals to reduce gastric irritation. O. Take iron with citrus juices to enhance absorption. O. Advise client not to take iron with milk, tea, or antacids they decrease iron absorption. O. Encourage client to eat a well-balanced diet. O. Keep drug out of reach of children extremely toxic. O. When administering iron to child, dilute it with water or fruit. Juice and use a straw to minimize teeth staining. O. Discuss with client the possibility of indigestion, changes in stool, color black, and constipation. 1 ferrous sulfate, ferrograd, Ri for class antianemic, iron. Advantages O. Less expensive AO. Most effective oral preparation oral. More stable in air. Pharmacology for midwives. 84. Prophylaxis 300 mg daily oral. Treatment 300 mg bid. 2 iron dextrin injection, Imferin. Class. Iron preparation, parenteral. The only iron preparation used parenterally. Uses, IM or Roman 4 for iron deficiency anemia when oral administration is not possible. Side effects, anaphylaxis, rashes, nausea, vomiting, diarrhea, hypotension, tachycardia, shock, or IM causes brown skin, abscess formation, or Roman 4 leads to phlebitis. Nursing considerations. Should never be mixed with other medications or added to. Parenteral nutrition. Obtain vital signs to determine client's response to therapy. Give the drug IM deeply or Roman 4 slowly. Prevent staining of skin by using a separate needle. Be prepared to assist with treatment of iron intoxication. Folic acid. Generic name Folvite. Action. Stimulates production of red and white blood cells and platelets in some megaloblastic anemias. Indications and dosages. Recommended dietary allowance. Pharmacology for midwives. 85. Megaloblastic anemia related to folic acid deficiency and nutritional deficiency, pregnancy, childhood, or infancy. Folate deficiency. Dose 150 to 400 mcg, up to 1 mg/day. Contraindications and precautions. Black circle contraindicated in pernicious, aplastic, or normocytic anemia. Black circle used cautiously in breastfeeding patients. Adverse reactions. Altered sleep pattern, malaise, poor concentration, impaired judgment. Hyperactivity, anorexia, nausea, flatulence, bitter taste, allergic reaction, including rash, pruritus, erythema, bronchospasm. Nursing considerations. 1. Teach women about importance of taking daily dose 3 months before pregnancy and in first trimester as it decreases fetal neural tube defects by 50%. 2. It is not effective in normocytic anemias. Anticoagulants and hemostasis. Prothrombin, thromboblast, and thrombin. Fibrinogen, thrombin, fibrin, insoluble protein. Pharmacology for midwives. 86. Anticoagulants. 1. Warfarin, sodium, Coumadin. Class anticoagulant. Action. Prevent the formation of factors Roman 2, Roman 7, Roman 9 and X in the liver. Uses O. Prophylaxis and treatment of deep venous thrombosis. O. Thromboembolism. Thrombophlebitis O. Prophylaxis for myocardial infarction. Contraindications O. Hemorrhagic tendencies O. Blood disorders O. Ulcerative lesion of GIT O. Impaired renal and hepatic function O. Severe hypertension O. Thrombocytopenia. Drug interaction O. Antacids. Decrease effective anticoagulants by decreasing its absorption O. Salicylate effective anticoagulants. Side effects hemorrhagic accidents. Antidote vitamin K. Nursing considerations. O. Daily monitoring of prothrombin time is recommended. O. Instruct clients to take the drug before meal. O. Remind clients to wear identification band that states that they. Pharmacology for midwives. 87. O. Advise client to avoid activities that may cause injury. O. Vitamin K should be available. O. Food rich in vitamin K should be avoided. 2. Heparin. Class anticoagulant. Naturally occurring substance isolated from porcine intestinal, mucosa or bovine lung tissue. Must be given parentally. Doesn't interfere with wound healing. Action. Potentiate the inhibitory action of antithrombin Roman 3 on various coagulation factors. Inactivate thrombin and prevent the conversion of fibrinogen to fibrin. Uses. O. To prevent extension of clots. O to prevent thrombi and emboli from occurring. O prophylactic from thromboembolic diseases. O after some types of surgery, cardiac, orthopedic, and vascular. Pharmacology for midwives. ADA. O menstruation. O abortion. O any drugs or conditions affecting blood coagulation. Side effects: hemorrhage. Overdose: nose bleeding, hematuria, petechiae, tarry stool. Antidote: protamine sulfate. Dose: Roman 4 or SC measured in units according to bleeding and clotting. Time. Nursing considerations. O should not be administered IM, administered by deep SC2. Minimize local irritation and to prolong the action of drug. O don't massage before and after injection. O change site of administration to avoid ecchymosis. O instruct and stress the importance of reporting any signs of active bleeding. O use electric razor for shaving, soft bristle toothbrush to decrease gum irritation. O patient should be hospitalized for Roman 4 therapy. O clotting time, PTT should be done before the start of therapy. Pharmacology for midwives. 89. Roman 3 thrombin complex coagulation inhibitor deactivating thrombin and preventing conversion of fibrinogen to fibrin. Indications and dosages. Patients at risk for thromboembolic complications: pulmonary embolism and deep vein thrombosis due to severely restricted mobility during acute illness or post a major surgery. Prevent blood clots. In some cases of pregnancy, sometime a blood clot is formed in the umbilical cord due to antiphospholipid syndrome, which leads to miscarriage. Adults 40 mg subcutaneously daily. Contraindications: hypersensitivity to clexane or heparin, thrombocytopenia, active major bleeding, major blood disorders, certain types of stroke. Do not give clexane to a child. Pharmacology for midwives. 90. Adverse reactions: CNS, dizziness, headache, insomnia, confusion, cerebrovascular accident, CV, edema, chest pain, atrial fibrillation, heart failure, GI, nausea, vomiting, constipation, urinary retention, hematologic, anemia, bleeding tendency, thrombocytopenia, hemorrhage, skin, bruising, pruritus, rash, urticaria, irritation, or erythema, injection site. Nursing considerations: monitor CBC and platelet counts. Watch for signs and symptoms of bleeding or bruising. Instruct patient to promptly report regular heartbeat, unusual bleeding or bruising, rash. Teach patient safety measures to avoid bruising or bleeding. Phytonate ion vitamin cone. Class: vitamin. Action: pharmacology for midwives. 91. Contraindications and precautions. Contraindicated in hypersensitivity to drug. Use cautiously in pregnant or breastfeeding patients and children. Adverse reactions: hyperbilirubinemia in infants with parenteral administration. Pain, swelling. Tenderness at injection site, itchy rash after repeated injections. Transient flushing sensations, anaphilic reaction. Thrombolytic agents. Agents used to promote the dissolutionlessness of the insoluble fibrin. Trapped in intravascular emboli and thrombi. The most serious complication is hemorrhage. Heparin therapy usually follows treatment with these agents. 1 streptokinase. Class: thrombolytic agent. Action: acts with plasminogen to produce an activator complex which enhance the conversion of plasminogen to plasmin, which breaks down fibrinogen, fibrin clot, and other plasma proteins. Uses: deep venous thrombosis, DVT. Pharmacology for midwives. 92. Antifibrinolytic agents. Tranexamic acid. Trade name: hexacaprone. Classification: antifibrinolytic. Uses: prevention of heavy bleeding such as heavy periods, nosebleed. Prevention of bleeding during tooth extraction in hemophiliacs, people who lack a clotting fact. Contraindications: pregnancy, breastfeeding, history of thromboembolic disease, kidney problems, bleeding disorders, and menstrual bleeding. Side effects: nausea, vomiting, diarrhea. Nursing considerations: 1. To overcome GI problems, instruct patient to eat little and often and eat simple foods such as dry toast. 2. Teach patient to drink plenty of fluids. 3. Watch for thrombus or embolus formation. 4. Teach patient to report sudden slurred speech, loss of coordination, pain in the chest or groin or leg. You should contact a doctor as soon as possible. If any of these occur, stop taking the medication and see your doctor. Pharmacology for midwives. 93. Cardiac drugs. Cardiac glycosides. Digitoxins are plant alkaloids. They increase myocardial contractions, which will increase blood Supply to all organs including the kidneys, therefore causing diuresis, which will decrease the edema. They are used to treat cardiac or arrhythmia because they decrease heart rate. Action. They increase the force of myocardial contractions positive, nootropic. They increase the contractility of the heart muscle by minimizing the movement of NOT and K ions and increasing the release of Ca ions in the myocardial cells. It decreases the heart rate due to increase in parasympathetic nervous system and decrease in the sympathetic tone. They are primarily excreted through the kidneys. The initial dose is the larger dose, the loading or digitalizing dose. The subsequent doses are referred to as maintenance doses. Pharmacology for midwives. 94. 2. Cardiac arrhythmia, atrial fibrillation, atrial flutter and sinus tachycardia. Contraindication. 1. Hypersensitivity. 2. Angina pectoris in absence of CHF. 3. Given with caution for elderly and people who have kidney failure. Side effects. 1. They are extremely toxic and may cause death. 2. There is a narrow margin of safety between the therapeutic dose and the toxic dose. 3. Could cause overdose by cumulative effects of the drug so frequent. Assessment of the serum level is essential. 4. May cause cardiac or arrhythmias such as bradycardia below than 60 beats/minute and other dysarrhythmia. 5. Nausea, vomiting, and diarrhea. 6. Headache, malaise and muscle weakness. 7. Skin rashes, blurring of vision, diplopia, and wall halos. No. Patients suffering from digitalis intoxication should be admitted to Pharmacology for Midwives. 95. Predisposing factors for digitalis toxicity. 1. K loss hypokalemia, which results from diuretics, NPO, gastric suction, and poor K intake. 2. Pathological conditions. A liver disease, they decrease metabolism and therefore increase digitalis level. B. Kidney disease, they decrease the excretion of drug and therefore increase digitalis levels. Nursing considerations. Check doctor's order, medication record and bottle label accurately. Observe, monitor for evidence of bradycardia or arrhythmia. Measure intake and output accurately. Weigh the patient on daily basis. Pulse should be checked by 2 nurses. Provide the client with fruits high in potassium as banana, orange. Monitor serum digoxin level. Elderly people should be assessed for early signs of toxicity. Have digoxin antidote available, digoxin immune FAB. Drugs. Pharmacology for midwives. 96. Dose. Digitalization dose equals 0.4 0.6 mg followed by 0.5 0.35 mg once or twice daily. Antidote digoxin immune FAB ovine. Coronary acidolators. 1. Antianginal drugs. Angina pectoris is a clinical syndrome characterized by paroxysm of pain in the anterior chest caused by insufficient coronary blood flow and/or inadequate oxygen supply to the myocardial muscle. Causes. 1. Atherosclerosis. 2. Vasospasm. There are 3 groups of drugs used for treatment of angina. 1. Nitrates/nitrites. 2. Beta-adrenergic blocking agents. 3. Calcium channel blocking agents. Nitrates/nitrites. Nitrates/nitrites action, direct relaxation of blood vessels and smooth muscles, vasodilation outflow requirements. Relaxation of smooth muscles of coronary arteries, coronary vasodilation blood supply to the myocardium. Relaxation of arteries and veins, BP workload in the heart. Indications. 1. Prophylaxis and treatment of acute angina pectoris. 2. Treatment of chronic angina pectoris. 3. Treatment of hypertension associated with MIO-CHF. 4. Pharmacology for midwives. 97. Contraindications. 1. Sensitivity to nitrates, hypotension. 2. Severe anemia. 3. Hypotension. 4. Head trauma. 5. Cerebral hemorrhage. Side effects. 1. Headache, syncope, dizziness. 2. Postural hypotension, transient flushing, and palpitation. 3. Topical application may lead to dermatistes. Drug interaction, antihypertensive agents, beta-adrenergic blocking agents, and calcium channel blocking agent that may lead to additive hypertension. Dosage. There are several forms available. 1. Sublingual, Gordal 5 mg PRN. 2. PO iStar 2040 mg twice a day. 3. Topical, available as patches or ointment. 4. Parenteral rumen for infusion. Nursing considerations. 1. Medication should be taken on an empty stomach. 2. Carry sublingual tablets in a glass bottle tightly capped. 3. If vaginal pain is not relieved in 5 minutes by first sublingual tablet. 2. Take up to 2 more tablets at 5 minutes interval. If pain has not subsided 5 minutes after the 3rd tablet, client should be taken to the emergency room. Pharmacology for midwives. 98. 5. Take sublingual tablets while sitting to avoid postural hypotension. Isosorbate dinofrate. Present in the forms of capsules, chewable, sublingual tablets. Trade names Cordil Isotar. Class coronary vasodilator. Dosage forms caps 20-40 mg, tabs 20-40 mg. Uses. Tabs for only prophylaxis of anginal pain. Chewable, sublingual to terminate acute attack and relieve acute pain. Esophageal spasm. Side effects headache, hypertension. Dosage. Sublingual acute attack 2.5-5 mg Q2-3 HRS. Oral caps/tabs 5-20 mg Q6 HRS. Extended release tabs 20-80 mg Q8-12 HRS. No isosorbide mononitrate given for patients with liver impairments. Calcium channel blocking agents. Action for contraction of cardiac and smooth muscle to occur. Extracellular calcium must move into the cell through openings cold. Pharmacology for midwives. 99. Nifedipine Adalat. Class calcium channel blocking agent, anti-angina, antihypertensive. Uses vasospastic angina, essential hypertension. Contraindications hypersensitivity, lactation. Side effects pulmonary and peripheral edema, mild hypotension. Headache, muscle cramps, flushing. Dosage 10-30 mg TID. In hypertensive emergencies, 10-20 mg given orally or sublingually by puncturing the capsule and squeezing contents under the tongue. Verapamil, Eccar. Class calcium channel blocking agent, anti-angina, antihypertensive. Uses. PFO, angina pectoris or atrial fibrillation and flutter. Essential hypertension. Warming for supraventricular tachycardia. Contraindications hypotension, cardiac shock, and MI. Side effects AV block, bradycardia, headache, dizziness, abdominal cramps, blurring of vision, and edema. Pharmacology for midwives. 100. 6. Calcium antagonists should be taken with meals to GI irritation. Antihypertensive drugs. Hypertension is a condition in which the mean arterial blood pressure is elevated. Essential hypertension could be mild, moderate, or severe and may lead to dangerous changes in kidneys, eyes, and blood vessels. Secondary hypertension, a certain disease or condition, leads to elevation of blood pressure such as toxemia or pregnancy, acute kidney failure, etc. Antihypertensive agents are initiated when diastolic blood pressure is higher than 90/Hg. Treatment of hypertension includes 1. Weight reduction. 2. Sodium restriction. 3. Alcohol restriction. 4. Stop smoking. 5. Exercise. 6. Behavior modification. Single drug should be considered from the following classes. Pharmacology for midwives. 101. 2. Evaluate the extent of the client's understanding of the disease and the therapy. 3. Ascertain lifestyle changes. 4. Determine client's ability to take his BP measurement. 5. Record significant changes in BP readings. 6. Advise client to adhere to low-sodium diet. 7. Explain the importance of adhering to treatment's plan. 8. Teach the patient/family how to measure intake and output. 1. Angiotensin-converting enzyme inhibitors. Captopril. Trade name Capitin Enhabase. Class antihypertensive, inhibitor of angiotensin synthesis. Action. Captopril is a highly specific competitive inhibitor of angiotensin I converting enzyme. The enzyme is responsible for the conversion of angiotensin I to angiotensin Roman II, which decrease BP, reduce peripheral arterial resistance, decrease aldosterone secretion, which works to increase level of serum potassium. Pharmacology for midwives. 102. Dosage. Tablets. 12.5 mg 2-3 times per day. If there is no response after 1-2 weeks, increase dose to 25 mg 2-3 times per day. Nursing considerations. 1. In case of overdose, give normal saline to restore BP. 2. Should not be discontinued without doctor order. 3. Obtain baseline hematological studies, liver and renal functions tests prior to beginning the treatment. 4. Determine client's understanding of the therapy and if he/she takes other medications. 5. Observe client closely for hypertension 3 hours after the initial dose. 6. In case of hypertension, place client in supine position and give room for saline infusion. 7. Withhold potassium-sparing diuretics and consult with physician. Hyperkalemia may occur. 8. Take captopril 1 hour before meal or on an empty stomach. 9. Report skin rash, heartburn, and chest pain to physician. Pharmacology for midwives. 103. Blocking of beta-1 receptors HR, myocardial. Contractility and cardiac output BP. Blocking of beta-2 receptors, airway resistance, bronchospasm, and vasoconstriction. These drugs could be selective, working on one receptor such as beta-1. Selective drugs, atenolol, or it could be non-selective such as propranolol. Uses: 1. Hypertension. 2. Angina pectoris. 3. Cardiac arrhythmias. 4. Myocardial infarction. 5. Prophylaxis of migraine. Contraindications: bradycardia CHF, cardiogenic shock, diabetes, thyrotoxicosis, chronic bronchitis, asthma, bronchospasm, emphysema. Side effects: bradycardia CHF, hypotension, cold extremities due to peripheral vasoconstriction, edema, dyspnea, shortness of breath, nausea, vomiting, hepatomegaly and bronchospasm. Treating overdose: 1. Inducing vomiting, gastric lavage. 2. Artificial respiration. 3. Give atropine sulfate 0.6 mg up to 3 mg in glycogen for the treatment of bradycardia. 4. Treat hypoglycemia and hypokalemia. 5. IV fluids. 6. Adrenaline or dopamine to increase blood pressure. Nursing considerations. Pharmacology for midwives. 104. 2. Provide written instructions as when to call physician e.g. HR below 50. DEET/min. 3. Consult the physician before interrupting the therapy. 4. Some drugs lead to blurring of vision, so that tell patients not to engage in activities that need mental alertness. 5. Instruct patient to dress warmly during cold weather. 6. Diabetic patients should be very careful about symptoms of hypoglycemia. 7. Report any asthma-like symptoms. Atenolol. Trade name Normatin. Classification: beta-adrenergic blocking agent. Classification: beta-1 adrenoreceptor blocking drug, which is A. Cardioselective. Uses: hypertension, angina pectoris. Dosage: tablets 50 mg or 100 mg daily. Initial dose is 50 mg. If there is no response, increase dose to 100 mg daily. Roman 4: in case of acute MI, give 5 mg over 5 minutes, and if there is no response, give another 5 mg after 10 minutes. Specific nursing considerations. 3. For Roman 4 use, the drug may be diluted in sodium chloride, dextrose on, dextrose saline, propranolol hydrochloride. Trade name Inderal, Darylin. Classification: beta-adrenergic blocking agent, antiarrhythmic. Pharmacology for midwives. 105. Action: manifests both beta-1 and beta-2 adrenergic blocking activity. Indication: 1. Angina pectoris. 2. Hypertension. 3. Cardiac arrhythmias. 4. Prophylaxis of migraine. 5. Prophylaxis of MI. 6. Pheochromocytoma. Additional side effects: psoriasis-like eruptions. Dosage: tablets, initial dose of 40 mg bid, then 120 minus 240 mg in 2-3 divided doses. Contraindications: asthma. 3. Centrally acting agents. Methyldopa. Trade name Aldermin. Classification: antihypertensive, centrally acting antiadrenergic agent. Action: the active metabolite alpha-methanorepinephrine lowers BP by stimulating central inhibitory alpha-adrenergic receptors. Uses: hypertension and hypertension crises parenteral. Contraindications: 1. Hypersensitivity. 2. Active hepatic diseases. 3. Pheochromocytoma. Side effects: headache, dizziness, general weakness, depression and sedation. Bradycardia, orthostatic hypotension. Dry mouth, nausea, vomiting, so black tongue. Jaundice, liver disorders. Hemolytic anemia and leukopenia. Pharmacology for midwives. 106. Male impotence. Dosage: tabs. Initially 250 mg bitrate. Nursing considerations. 1. Avoid activities that need mental awareness, such as driving. 2. Note any evidence of jaundice and do liver function test on intervals. 3. Advise PT to rise from the bed slowly. 4. Instruct PT about reportable signs and symptoms. 5. Explain to PT that urine rarely may be turned into dark/blue color. 6. Advise client to carry a card detailing current medication regimens. Always. 5. Agents that act directly on vascular smooth muscles. Hydralazine hydrochloride. Trade name Apreoline. Classification: antihypertensive, direct action on vascular smooth muscles. Action: directly affects smooth muscles vasodilation. Pharmacology for midwives. 107. Side effects: orthostatic hypotension, tachycardia, nausea, vomiting, headache, dizziness, constipation, and male impotence. Dosage: tabs. Initially 10 mg kid for 2 minutes 4 days, then 25 mg bid. IV/IM 50 mg Roman 4 slowly repeated as necessary. May decrease BP in 5 minutes. Drugs affecting the central nervous system. Barbiturates. Phenobarbital. Trade name: luminal. Class: sedative anticonvulsant barbiturate. Action: long-acting barbiturate acts as a sedative, hypnotic, and anticonvulsant by producing CNS depression. It increases the inhibitory activity on nerve synapses. Uses: 1. Pre-anesthetic medication. 2. Sedation. Pharmacology for midwives. 100A. Forms and dose. Tablets 100, ampules 100,000 in 1 cc. Sedation 30 minutes 120 mg daily in 2-3 divided doses. For adults, hypnotic 100 minutes 320 mg at bedtime. Anticonvulsant IV 100 minutes 320 mg repeated as necessary. Preoperative sedation IM only 130 minutes 200 mg 60 minutes 19 minutes before surgery. NB luminal can be used in neonates as antihyperbilirubinemia. Overdose: manifested by tachycardia, hypothermia, coma, respiratory depression, absent reflexes, respiratory muscle relaxation, and vascular collapse. Treatment of overdose toxicity: 1. Maintain and assist respiration as indicated. 2. Support circulation by vasopressor and IV fluids as required. 3. Aspirate stomach contents. Take care to avoid pulmonary aspiration. 4. Diuretics may be given as ordered. 5. Intake and output measurement. 6. Dialysis if indicated. Pharmacology for midwives. 109. 5. Take the medication only as prescribed. 6. If used for hypnotic effect, give a half-each hour before bedtime. 7. Teach patient about signs and symptoms of toxicity and instruct patient to report them to treating physician. 8. If taken for 8 weeks or more, instruct patient not to stop it suddenly. 2. Avoid withdrawal symptoms as convulsion. 9. Keep the drug out of reach of the children. Anti-anxiety agents: temazepam, lorazepam, alprazolam, diazepam. Trade name: Valium, Civil. Class: anti-anxiety agent, benzodiazepine. Action: the anxiolytic effect is believed to be mediated through the action of benzodiazepine to increase the inhibitory action of GABA gamma. Aminobutyric acid inhibits CNS neurotransmitter. The drug is metabolized in the liver and excreted through urine. Indications: 1. Symptomatic relief of anxiety and tension. 2. Alcohol withdrawal. 3. Muscle relaxant. 4. Anticonvulsive. 5. Preoperatively. Pharmacology for midwives. 110. Contraindications: hypersensitivity, acute narrow-angle glaucoma, pregnancy, shock coma, alcoholic intoxication to avoid respiratory of depression. Side effects: drowsiness, fatigue, ataxia, hypotension, visual disturbances, headache, phlebitis at injection site. Dosage: ampules of 2 ml containing 10 mg, tablets 2 mg, 5 mg, or 10 mg, IV or IM 2-20 depending on the indication. Tablets 2-10 mg 2-4 times daily. Nursing considerations: stress that drug may reduce PT's ability to handle dangerous equipment. Avoid alcohol ingestion. Don't stop taking the medication suddenly, withdraw drug gradually. Monitor BP before and after administration. Pharmacology for midwives. 111. Uses: acute and chronic psychosis such as schizophrenia, mania, and manic depression. Pre-anesthetic. Intractable hiccups. Nausea and vomiting. Contraindication: severe depression, coma, bone marrow depression, patients with history of seizures and on anticonvulsant therapy, hepatic and renal diseases, prostatic hypertrophy, dehydration, glaucoma, measles. Side effects: depression, dizziness, seizures, gynecomastia, orthostatic hypotension, bronchospasm, lull in eospasm, tardive dyskinesia, photosensitivity, leukopenia, aplastic anemia, and dry mouth. Dose: pharmacology for midwives. 112. Take liver and kidney function tests periodically. Document and rotate injection sites. Report side effects immediately. Determine age of male patients and assess for prostatic hypertrophy. Lithium carbonate. Trade name lithium. Class antipsychotic antiemetic. Action. Action is not known. Theories trying to explain the action of this drug include effectiveness to an alteration in ion metabolism within nerve and muscle cells plus KIN and ATP acid catecholamine. Neurotransmitter levels hyperactivity. Uses. Control of manic and hypomanic episodes in manic depression patients. Prophylactic of bipolar depression. Dose PO 600 mg to kid. Side effects. Drowsiness, dizziness, hand tremors, lethargy. Hypothyroidism, EC. Changes, anorexia, dry mouth, nausea, vomiting, polyuria, leukocytosis. Pharmacology for midwives. 113. Pregnancy and lactation. Dehydration. Patients receiving diuretics. Sodium depletion. Nursing considerations. Monitor serum level of lithium every 1 minute 2 weeks to prevent toxicity. Normal level is 0.4 1.0 mol/L and toxic level is above 1.5 mol/L. Monitor for pulse irregularities and changes in BP. Provide diet adequate in sodium. Monitor for signs and symptoms of toxicity. Avoid factors that enhance toxicity, dehydration, renal failure, infection. Co-administration of diuretics and sodium depletion may occur with diuretics. Maintain adequate fluid and sodium levels. Withdrawal stopping drugs should be gradual over weeks. Antidepressants. 2. Tricyclic antidepressants. Clomipramine hydrochloride. Trade name Anafranil. Pharmacology for midwives. 114. Panic disorders. Phobic disorders. Contraindications, pregnancy, lactation, shock, bone marrow depression. Side effects. Hypothermia, seizures, anemia, muscle weakness, drowsiness, ataxia. Blurring of vision, orthostatic hypotension, dry mouth, constipation. Nursing considerations. Monitor vital signs before and during therapy. Take with food to decrease GI upset. Imipramine hydrochloride. Trade name Tofranil. Class. Antidepressant tricyclic. Action as Anafranil. Uses. Relief symptoms of depression. Enuresis in children. Dose. For treatment of depression PO 50 mg bid or TID. For treatment of children in enuresis 6 years or older 25 mg day. Pharmacology for midwives. 115. Class anticonvulsant, antiarrhythmic. Action acts in the motor cortex of the brain to reduce the spread of electrical discharges from the rapidly firing epileptic foci in this area. Also activity of centers in the brain stem responsible for the tonic phase of grand mal seizures. Uses. Chronic epilepsy. Premature ventricular contractions. Tachycardia. Contraindications. Hypersensitivity. Side effects. Drowsiness, ataxia, dizziness, measles-like rash, gingival hyperplasia, hirsutism, excessive hair growth, hypoglycemia. And B. Rapid IV, administration, hypertension, and arrhythmia. Dose for arrhythmia is tabs 200 minutes 400 mg daily. IV 100 mg q 5 minutes up to a maximum of 1 g. Nursing considerations. Pharmacology for midwives. 116. 7. Take food to minimize GI upset. 8. If the patient is diabetic, monitor for signs of hypoglycemia. 9. Oral hygiene to minimize bleeding from the gum. 10. Report any excessive growth of hair. 1. Carbamazepine. Trade name Tigritol. Plus. Anticonvulsant. Action similar to cyclic antidepressant. Antimanic, antidiuretic, anticholinergic, and antipsychotic effects. Anticonvulsant action unknown. Uses: epilepsy, tonic-clonic seizures, alcohol withdrawal, resistant schizophrenia, trigeminal neuralgia. Dose: PO 200 mg bid. Trigeminal neuralgia 100 minutes 200 mg bid. Side effects: photosymptoms of epilepsy, drowsiness, dizziness, unsteadiness, aplastic anemia, nausea, vomiting, blurring of vision. Contraindications: bone marrow depression, hypersensitivity, lactation, patients taking MAO inhibitors. Nursing considerations: should be taken with food. Obtain baseline liver and kidney function. Pharmacology for midwives. 117. Protect tablet from moisture. Obtain baseline eye examination. Blood cells evaluation weekly. Monitor intake and output. Use safety measures. Advise client to avoid sunlight. Photosensitivity. 2. Magnesium sulfate. Class: anticonvulsant, electrolyte, saline laxative. Action. It is an important cation present in the extracellular fluid. It is an essential electrolyte for muscle contraction, certain enzyme, system and neurotransmissions. Magnesium depresses CNS and control convulsion by blocking the release of acetylcholine at the myelin junction. Uses. Seizures associated with toxemia of pregnancy, epilepsy, laxative, hypomagnesemia. Pharmacology for midwives. 118. NB. Suppression of knee-jerk reflex can be used to determine toxicity. Respiratory failure may result if drug is given after disappearance of this reflex. Treatment of magnesium intoxication. 1. Use artificial ventilation immediately. 2. Of calcium glutamate readily available for IV use. Dose anticonvulsant IM 1-5G of 25% 50% solution. IV 1-4G of 10% 20% solution. Nursing considerations. For IV administer only 1.5 ml of 10% solution /minute. For IM, inject the drug deep into the muscle using 50% solution. As a laxative, dissolve in a glass of ice water or other fluid to lessen disagreeable taste. Obtain baseline Mg level. Obtain history of kidney disease. Check with the physician before administering magnesium if any of the following conditions exists. 1. Absent patellar or knee-jerk reflex. 2. R less than 16 /m. Pharmacology for midwives. 119. Narcotic analgesics and antagonists. Narcotic analgesics. It include opium such as morphine, codeine, and opium derivatives such as meperidine. These substances have similar pharmacological properties. Meperidine Demerol is the best known. The relative activity of all narcotic analgesics is measured against morphine. Dependence and tolerance. Remember that all drugs of this group may lead to addiction. Psychological and physical dependence and tolerance develop even when using in clinical doses. Tolerance usually develops because the patient requires shorter periods of time between doses or larger doses for relief of pain. Effects of narcotic analgesics. 1. On CNS. Alteration of pain perception, analgesia, euphoria, drowsiness, change in mood, mental clouding, deep sleep. 2. Depressed respiration, overdose leads to respiratory rest death. 3. Depressed cough reflex, codeine in small doses is used as antitussive. 4. Nausea and emetic effects stimulate the chemoreceptor trigger zone. 5. Morphine vasodilation, hypotension. 6. Pupillary constriction, the most obvious sign of dependence. 7. Decreases the peristaltic motility, constipation, some types. Pharmacology for midwives. 120. Acute toxicity. Characterized by respiratory depression, deep sleep, stupor, or coma. Pinpoint people are R2-4 /m, cyanosis, hypotension, decreased urinary output, decreased temperature, clammy skin, and finally death due to respiratory failure. Treatment of acute overdose. 1. Induced vomiting or gastric lavage. 2. Artificial respiration. 3. Give narcotic antagonist Narcan. NB. Respiratory stimulants. Caffeine should not be used to treat depression from overdose of narcotics. Chronic toxicity. The problem of chronic dependence on narcotics is well known and is not only the problem of the street, but is also found often among those who have easy access to narcotics: physicians, nurses, pharmacists. Narcotic analgesics sometimes used for non-therapeutic purposes. Signs and symptoms. Constricted pupil, constipation, skin infections, needle scar abscesses, and pharmacology for midwives. 121. Action exactly is unknown but may be by decreasing cell membrane permeability to sodium, transmission of pain impulses. Uses. Severe pain, hepatic and renal colic, pre-anesthetic medication, post-surgical pain, diarrhea and dysentery, pain from a carcinoma, postpartum pain and burns, antitussive, contraindications, asthmatic conditions, emphysema, severe obesity, convulsions, diabetic acidosis, myxedema, Addison's disease. Pharmacology for midwives. 122. Nursing considerations. Use supportive nursing measures as relaxation techniques to relieve pain before using narcotics. Explore the source of pain. Use non-narcotic analgesia if possible. Administer the medication when needed. Prolonging the medication administration will decrease the effect of the medication. Monitor vital signs and mental status. Monitor respiratory rate. Drug may lead to respiratory depression. Monitor blood pressure. Hypertension may occur. Monitor pulse rate of 60 /m. Withhold the drug. Watch for constricted pupils. Document it and notify the physician. Monitor bowel function, since drug may cause constipation. Encourage client to empty bladder every 3 minutes for HRS, since drug may cause urinary retention. If client is bedridden, use side rails. Inform the client/family that the drug may become habit-forming and leading to addiction. Document any history of asthma or other contraindications. Have emergency equipment and narcotic antagonist available. Pharmacology for midwives. 123. In high doses more than 60 mg, it will irritate the cough center, but in low doses, it is a potent antitussive and is an ingredient in many cough syrups. Uses: relief of mild to moderate pain. Antitussive. Dose: analgesic 15 minutes 60 mg Q4 minutes 6 HRS. Antitussive 10 minutes 20 mg Q4 minutes 6 HRS. 2. Meperidine hydrochloride, pethidine hydrochloride. Trade name Demerol. Plus. Narcotic analgesic, synthetic. Action similar to opiates. It has no antitussive effect. The duration of action is less than that of opium. Uses: severe pain, renal and hepatic colic, obstetric preanesthetic medication. Pharmacology for midwives. 124. Diabetic acidosis. Up. Side effects: transient hallucinations, hypotension. Dose: drug is available in the form of tablets, syrup by MSC. Doses 50 minutes 100 mg Q3 minutes 4 HR. It can be given as IV continuous infusion on a concentration of 1 mg/ml. It also can be given Roman solely and should be diluted in a concentration of 10 mg/ml. 3. Morphine sulfate. Class: narcotic analgesic, morphine type. Action: see narcotic analgesic. Uses: intrathecally, epidurally, orally or IV, infusion for acute or chronic. In preoperative medication, to facilitate induction of anesthesia or to decrease the dose of anesthesia. NB. It is given in low doses for continuous pain and in high doses in shock. Pharmacology for midwives. 125. Dose: oral 10 minutes 30 mg Q4 HR. IM 5 minutes 20 mg/70 kg Q4 HR is needed. IV bolus of 2.5 minutes 15 mg for a person of average weight of 70 kg over 4. 5 minutes slowly. Continuous infusion 0.1 minutes 1 mg/ml and 5% dextrose in water by A. Controlled infusion pump. 4. Tramadol hydrochloride. Trade name Ultram Tramadol. Plus. Narcotic analgesic, synthetic. Action unknown. A centrally acting synthetic analgesic compound not chemically related to opiates. Thought to bind to opioid receptors and inhibit reuptake of norepinephrine and serotonin. Indications and dosages: moderate to moderately severe pain. Adults initially 25 mg PO, adjust by 25 mg Q3 days to 100 mg/day. On divided doses. Adverse reactions: CNS, dizziness, vertigo, headache, CNS stimulation, anxiety, confusion. Pharmacology for midwives. 126. Skin, pruritus, diaphoresis, rash. Contraindications and cautions. Contraindicated in patients hypersensitive to drug or other opioid, in breast feeding women, and in those with acute intoxication from alcohol. Hypnotics, centrally acting analgesics, opioids, or psychotropic drugs. Use cautiously in patients at risk for seizures or respiratory depression, in patients with increased intracranial pressure or head injury, acute abdominal conditions, or renal or hepatic impairment, or in patients with physical dependence on opioids. Nursing considerations. 1. Reassess patient's level of pain at least 30 minutes after administration. 2. Monitor CV and respiratory status. Withhold dose and notify doctor if respirations decrease or rate is below 12 breaths/minute. 3. Monitor bowel and bladder function. Anticipate need for laxative. 4. For better analgesic effect, give drug before onset of intense pain. 5. Monitor patients at risk for seizures. Drug may reduce seizure threshold. 6. In the case of an overdose, naloxone may also increase risk of. Pharmacology for midwives. 127. Activities that require mental alertness until drug CNS effects are known. Narcotic antagonists. The narcotic antagonists are able to prevent or reverse many of the pharmacological actions of morphine-type analgesics and meperidine, as respiratory depression induced by these drugs within minutes. Naloxone hydrochloride. Trade name Narcan. Plus. Narcotic antagonist. Action. Block the action of narcotic analgesic by displacing previously given narcotics from their receptor sites or preventing them from attaching to opiate receptors. The duration of action of naloxone is shorter than that of the narcotic analgesic, so the respiratory depression may return when the narcotic antagonist has washed off the body. Uses. Respiratory depression induced by narcotics. Drug of choice when the depressant drug is unknown. Pharmacology for midwives. 128. Side effects. Nausea, vomiting, sweating, hypertension, tremors. If used postoperatively, tachycardia, pulmonary edema, hypo or hypertension. Dose 0.4-2 mg I, SC or IM. Nursing considerations. 1. Determine the etiology of respiratory depression. 2. Assess and obtain baseline vital signs. 3. Monitor respiration closely after the duration of action. 4. Have emergency drugs and equipment available. 5. If the patient is comatose, turn him to his side to avoid aspiration. 6. Maintain safe environment, side rails, and soft support. Non-narcotic analgesics and antipyretics. Drugs such as aspirin and acetaminophen are available without a prescription, thus consumed in large quantities for the relief of pain and fever. If they were used improperly, their administration may cause serious effects. They are responsible for accidental poisoning in small children. Pharmacology for midwives. 129. Action. The antipyretic effect is due to an action on the hypothalamus that results in heat loss by vasodilation of peripheral blood vessels and promoting wetting. The anti-inflammatory effect probably by decreasing prostaglandin synthesis and other mediators of the pain response. The analgesic action is not fully known but may be due to improvement of the inflammatory condition. NB. Aspirin also produces inhibition of platelet aggregation. Uses. Pain, myalgia, arthralgia, headache, dysmenorrhea. Antipyretic reduce fever. Anti-inflammatory arthritis, gout, rheumatic fever. To reduce the risk of recurrent ischemic attacks and strokes in men. Reduction of risk of death or non-fatal MI in patients with history of infarction or unstable angina pectoris. Dose. In minor conditions, 325 mg 600 mg q 4 hours. May reach up to 6 grams/day in divided doses in arthritis and rheumatic conditions. Contraindications. Hypersensitivity to salicylates. Asthma in conjunction with anticoagulant therapy. Vitamin deficiency risk for bleeding increase with vitamin K deficiency. Pharmacology for midwives. 113. Chickenpox or influenza potential risk for Ray's syndrome among children and teenagers. Pregnancy and lactation. 1 week before and after surgery. Patients receiving anticoagulants. Patients with bleeding disorders, i.e. hemophilia, GI bleeding or hemorrhage from other sites. History of GI ulcers. Side effects. Children with chickenpox Ray's syndrome. Heartburn, nausea, anorexia, cold blood loss. GI bleeding, potentiation of peptic ulcer. Bronchospasm. Anaphylaxis. Skin rashes. Increased bleeding time. Salicylate toxicity. Salicylism, nausea, vomiting, dizziness, tinnitus, difficulty hearing. Diarrhea, mental confusion. Pharmacology for midwives. 131. Hypotension may occur if taken with nitroglycerins. Nursing considerations. 1. Take drug with or after food or with milk to decrease GI irritation. 2. Assess for history of asthma and history of hypersensitivity. 3. Do not use with other anticoagulants. 4. Note any history of peptic ulcer. 5. Report signs of side effect e.g. gastric irritation if occurs. 6. Aspirin is not given 1 week before and after surgery to prevent bleeding. 7. If patient is diabetic, discuss the possibility of hypoglycemia occurring. 8. Patient should monitor their blood glucose level frequently. 9. Teaches patient about the toxic symptoms ringing in the ears, dizziness, mental confusion, etc. and ask him/her to report it to physician. 2. Acetaminophen, paracetamol. Trade names: Acamol, Panadol. Class. Non-narcotic analgesic, antipyretic. Action. Acetaminophen decrease fever by an effect on hypothalamus leading. Pharmacology for midwives. 132. Uses. Pain due to headache, dysmenorrhea, arthralgia, myalgia. Musculoskeletal pain, immunization, teething, tonsillectomy. To reduce fever due to bacterial and viral infection. As a substitute for aspirin when contraindicated. Contraindications: renal insufficiency, anemia. Side effects: Chronic and even acute toxicity can occur after long symptom-free usage. Hemolytic anemia, neutropenia, thrombocytopenia. Skin rashes, fever, jaundice, hypoglycemia. Symptoms of overdosage. Hepatic toxicity, general malaise, nausea, vomiting, fever, and vascular collapse, delirium, depression, seizures, coma, and death. Treatment of overdose. 1. Induction of emesis. 2. Gastric lavage. 3. Activated charcoal. 4. Oral N-acetylcysteine mucimist is said to reduce or prevent hepatic. Pharmacology for midwives. 133. Antirheumatic and nonsteroidal anti-inflammatory agents. Action. As in aspirin, the therapeutic actions of these substances are believed to result from the inhibition of the enzyme cyclooxygenase, which results in decreased prostaglandin synthesis, so it is effective in reducing joint swelling, pain, and morning stiffness, increasing the mobility in arthritic patients. Antipyretic action due to decreased production of prostaglandin from the hypothalamus, having irritating effect on the GIT. Uses: rheumatoid arthritis, osteoarthritis, gout, other musculoskeletal diseases, dental pain, strains and sprains. Contraindications: 1. Children less than 15 years of age. Pharmacology for midwives. 134. Dizziness, drowsiness, hypoplus hyperglycemia, bronchospasm, rhinitis, blurring of vision, tinnitus, loss of hearing, bone marrow depression, CHF. Nursing considerations. 1. Note any history of allergic responses to aspirin or nonsteroidal anti-inflammatory agents. NSAID. 2. Note the age of the client. 3. Determine if patient is taking oral hypoglycemic or insulin and document it. 4. Take these agents with milk or meal or antacids as prescribed. 5. Encourage patient to take drug regularly. 6. Report signs of GI irritation. 7. Instruct client to report signs of bleeding, blurring of vision, tinnitus, rashes, etc. 8. If the client has diabetes mellitus, explain the possible increasing. Pharmacology for midwives. 135. 1. Give on full stomach to avoid GI irritation. 2. When given IM, give it deep into a large muscle because drug is very irritant. 2. Indomethacin, trade name Indocid. Plus. Anti-inflammatory, analgesic, antipyretic. Dose, suppositories and caps. 25 and 50 mg bid. 3. Ibuprofen. Trade names Brufen, Ardofen. Plus. Non-steroidal anti-inflammatory analgesia. Dose 300 mg bid. Drugs affecting the autonomic nervous system. Sympathomimetic adrenergic drugs. The adrenergic drug supplement mimic and reinforce the message transmitted by the natural neurohormones norepinephrine and epinephrine. These hormones are responsible for transmitting nerve impulses of the sympathetic nervous system. The adrenergic drugs work in 2 ways. Pharmacology for midwives. 136. The myoneural junction is equipped with special receptors for the neurohormones. These receptors are classified into alpha receptor and beta-beta receptors, according to whether they respond to epinephrine, norepinephrine, and to certain blocking agents. Alpha receptors are blocked by phentolamine, where beta receptors are blocked by propranolol and similar agents. Both alpha and beta receptors have been divided into subtypes. Alpha receptors. Alpha-1 adrenergic. Alpha-2 adrenergic. Vasoconstriction of skin. Insulin secretion. Blood vessels. Decongestion. Motility plus secretion of GIT. Dilatation of eye pupil. Pharmacology for midwives. 137. Beta-1 adrenergic. Beta-2 adrenergic. Increased myocardial contraction. Skeletal and coronary vasodilation. Increased heart rate. Bronchial dilation. Improve impulse. Renin secretion. Lipolysis. Motility and secretion of GIT. Gluconeogenesis. Effects of adrenergic drugs. 1. Heart. Increase heart rate, increase force of contraction, increase cardiac output. Uses: cardiogenic shock, bradycardia, resuscitation, heart block. 2. Blood vessels, systemic vasoconstriction, decreased blood supply to abdominal viscera, cerebrum, and skin. BP. Enlarged vessels, increased and regulated. Uses: hypotension, nasal decongestion, biliary colic, nosebleeds. Pharmacology for midwives. 138. 7. Metabolism, increase in glycogenesis, sugar metabolism. Increase in lipolysis, release of fatty acids. Drugs. 1-albuterol salbutamol. Trade name Ventolin. Class sympathomimetic agent bronchodilator. Action stimulate beta-2 receptors of the bronchi leading to bronchodilation. Uses bronchial asthma, bronchospasm due to bronchitis or emphysema. Parenteral for treatment of status asthmaticus. Dosage aerosol for inhalation 0.18–0.2 mg, 2 inhalations every 48 hours. Solution for inhalation 1.25 mg into 5 ml. Oral syrup tablets 2–6 mg taken. Side effects tachycardia, arrhythmias, anginal pain, nausea, vomiting. Pharmacology for midwives. 139. Observe client for evidence of allergic response. Never give the solution prepared to be given as inhalation by the rumen for route. It may cause severe tachycardia. 2 epinephrine. Trade name adrenaline. Class direct-acting adrenergic agent. Action a natural hormone produced from adrenal medulla induced marked stimulation of alpha, beta-1 plus beta-4 receptors causing cardiac stimulation. Bronchodilation and decongestion. Uses 1 relief of respiratory distress due to bronchospasm. 2 rapid relief of hypersensitivity reactions. 3 cardiac arrests. 4 open angle glaucoma. 5 to prolong the action of anesthesia. 6 topically to stop bleeding. Contraindications neuroangle glaucoma. Pharmacology for midwives. 140. Cerebral hemorrhage, urinary retention, headache, necrosis at injection. Side blurring of vision, photophobia. Dose available in ampoules of 1 containing 1 mg adrenaline. Can be given by I/M injection. I, B, and SC. 0.20–0.5 mg IM or SC plus Q20 min 4 HR is needed. NB for cardiac resuscitation 0.5 mg diluted to 10 ml with normal saline. May be administered IV or intracardiac to restore myocardial contractility. Nursing considerations. Never administer 100 solution rumen for. Use 1000 mg sol. For IV use. Use insulin 1 syringe to measure adrenaline. Administer adrenaline using piggyback set to adjust the rate of infusion. Administer infusion by electronic infusion device for safety and accuracy. Closely monitor patients receiving IV adrenaline infusion. Note the client for signs of shock, loss of consciousness, clammy, cold, skin, cyanosis, etc. Briskly massage site of SC or IM injection to hasten the action of the dog. Pharmacology for midwives. 141. The main effects. 1. Reduce spasm of smooth muscle such as spasm of the urinary bladder or intestines. 2. To block vagal impulses to the heart which will increase heart rate and conductivity. 3. To suppress or decrease gastric secretions, perspiration, salivation and secretion of bronchial mucus. 4. To relax the sphincter muscles of the iris and cause pupillary dilation, mydriasis and loss of accommodation for near vision. 5. Act on CNS producing such reactions as depression, scopolamine or stimulation, toxic dose of atropine to produce antiparkinsonism effect. Contraindications. Glaucoma, tachycardia, myocardial ischemia, prostate hypertrophy, myasthenia gravis, paralytic illness, mental impairment, lactation, hepatic disease. Side effects. Nausea, vomiting, dry mouth, constipation, heartburn, dizziness, drowsiness, headache, insomnia, blurring of vision, photophobia, flashing, euphoria, hallucination, flushing of the skin. Pharmacology for midwives. 142. Uses. Adjunct and peptic ulcer treatment. Irritable bowel syndrome. Treatment of spastic disorders of biliary tract. During anesthesia to control salivation and bronchial secretions. Parkinsonism. Anti-arrhythmic prophylaxis. Prophylaxis and treatment of toxicity due to cholinesterase inhibitor, including organophosphate pesticides. Ophthalmologic treatment of uveitis. Contraindications. See parasympatholytics. Side effects. See parasympatholytics. Dose. Tablets 0.31.2 mg Q4-6 HR. Available in 1 ml ampoule containing 1 mg atropine. IM, IP, and SC 0.40.6 mg Q4-6 hour for anticholinergic action. NB for treatment of toxicity from cholinesterase inhibitors. Organophosphorus poisoning. Give 2-4 mg rumen 4 initially, then 2 mg every. Pharmacology for midwives. 143. Assess client for change in pulse rate. In case of blurring of vision, assist on ambulating and give safety measures. scopolamine hydrobromide. Trade name hyoscine. Class: cholinergic blocking agent. Action: it is a parasympathetic agent. Depress the cerebral cortex, especially the motor area. Act as a powerful hypnotic. Uses: 1. Motion sickness prevention and control of nausea and vomiting. 2. Preanesthetic. 3. Antiarrhythmic. 4. Mydriatic and cycloplegic. 5. Adjunctive with other drugs to treat GI ulcers. 6. With other narcotics to treat biliary colic. Contraindications: hypersensitivity, glaucoma, bronchial asthma, cardiac arrhythmias, pregnancy, lactation. Dose: oral 25 mg hour before travel for motion sickness. Parenteral 0.30 to 0.6 mg SC or IM. Side effects: pupil dilation, photophobia, blood vision, headache, drowsiness, dry mouth, constipation, nausea, vomiting. Pharmacology for midwives. 144. Tachycardia, arrhythmia, suppression of lactation, flushing, nasal congestion. Nursing considerations: azatropine, antihistamines, hormone blockers. Histamine is stored in almost every type of tissue in the body. Appropriate stimuli including tissue injury, antigen antibody allergic reactions, and extreme cold trigger the release of histamine from its storage sites into the vascular system, where it induces the following responses: 1. Dilation and increased permeability of the small arterioles and capillaries. Results in increasing permeability to fluid, leading to hypertension and edema, nasal congestion, and laryngeal edema associated with allergies. 2. Contraction of some smooth muscles such as those of bronchioles, leading to bronchoconstriction. The role of histamine plays in bronchial asthma and uterine contraction. 3. Stimulation of acid secretion in the stomach and salivary, bronchial, and intestinal secretions. 4. Dilation of cerebral vessels, headache. Pharmacology for midwives. 145. Antihistamines used for the treatment of allergic conditions are referred to as hormone receptor blockers, while those used for treatment of GI disorders as peptic ulcer are referred as H4 receptor blockers. They don't prevent the release of histamine. They prevent or reduce increased permeability, edema, and itching, and bronchospasm. Hormone blockers manifest varying degrees of CNS depression, anti-cholinergic and antiemetic effect. Uses: treatment of seasonal allergic rhinitis, allergic conjunctivitis, treatment of urticarial transfusion reactions, treatment of atopic dermatitis, treatment of insect bites, sneezing and rhinorrhea due to common cold, prophylaxis and treatment of motion sickness, nausea, and vomiting. Nighttime sleep aid. Contraindications: hypersensitivity, pregnancy. Pharmacology for midwives. 146. Side effects: sedation, deep sleep, dizziness, headache, muscle weakness, disturbed coordination, epigastric distress, dry mouth, nausea, vomiting, urinary frequency, anemia, hansatopnia, paradoxical excitation, especially in children and elderly, restlessness, irritability, insomnia, hysteria, tremors, euphoria, nervousness, hallucinations, disorientation, and convulsion. Usually caused by overdose, acute toxicity. Treatment of overdose: symptomatic and supportive. Vomiting is induced with syrup of Ikic. Gastric lavage. Vasopressors to treat hypotension, HE, dopamine, adrenaline. Phenytoin for treatment of convulsion. NP, don't use CNS depressants including diazepam. Nursing considerations: injecti, preparations deep into muscles. Oral preparations may cause gastric irritation, so give drug with meals. Pharmacology for midwives. 147. If the drug is being used for motion sickness, it should be taken 30 minutes before transporting. Caution the client not to drive a car or operate other machinery. Asterisk drugs in this group: 1. Brompheniramine malate. Trade name Astin. Class: antihistamine. Action: it has little sedative effect. Dose: each tablet contains 2 mg. 1 minus 2 tablets 3 minutes 4 times daily. 2 promethazine HCl. Trade name Phenergan, prothazine. Class: it is a potent antihistamine with prolonged action. It may cause severe drowsiness. It also provides antiemetic effect at chemoreceptor. Trigger zone: it also has a sedative action, effective in vertigo-vestibular apparatus. Uses: motion sickness, nausea and vomiting due to anesthesia. Pharmacology for midwives. 140. Sedative 25 mg 50 mg. Antivertigo 25 mg 2 times daily. Hormones and hormone antagonists. Insulin. Two main hormones are secreted from the pancreas. One, insulin, which is secreted by beta cells of islets of Langerhans and stored in the pancreas beta cells is a large protein known as proinsulin. Two, glucagon, which is thought to oppose the action of insulin. It is secreted by the alpha cells of islets of Langerhans. It converts glycogen to glucose and elevates blood glucose level. Diabetes mellitus is a disease in which the islets of Langerhans in the pancreas produce either no insulin or insufficient quantities of insulin. It is classified as insulin-dependent type 1 or juvenile onset and non-insulin-dependent type Roman 2 or maturity onset. It can be treated successfully by the administration of insulin, isolated from the pancreas of cattle or hogs or of human insulin, made either semisynthetically or derived from recombinant DNA. Technology. Pharmacology for midwives. 149. 1 isophane insulin suspension in pH. 2 insulin zinc suspension lent. 3 long-acting insulin. On. Protamine zinc insulin suspension PZIA. Q extended insulin zinc suspension ultra lent. NB. Insulin preparations with various times of onset and duration of action are often mixed to obtain optimum control in diabetic patients. Action. 1 facilitates the transport of glucose into cardiac and skeletal muscles and adipose tissue. 2 increases synthesis of glycogen in the liver. 3 stimulates protein synthesis and lipogenesis. 4 inhibits lipolysis and release of free fatty acids from fat cells. 5 causes intracellular shifts of potassium. NB. Since insulin is a protein, it is destroyed in the GIT, thus it must be administered parenterally. It is metabolized mainly in the liver. Uses. Pharmacology for midwives. 150. Side effects. 1 hypoglycemia due to overdose, decreased food intake or hard exercise, hunger, weakness, fatigue, nervousness, pallor, flushing, profuse sweating, headache, numbness of mouth, tingling in the fingers, blurred vision, hypothermia and loss of consciousness. Severe prolonged hypoglycemia may cause brain damage. 2 allergic urticaria, lymphadenopathy. Use human insulin product. 3 at the site of injection, developing of swelling, itching, atrophy, or hypertrophy of SC, fat tissue so rotate site of injection to minimize the problem. 4 insulin resistance caused by obesity, infection, trauma, surgery, etc. 5 hyperglycemic rebound somagy effect in patients who receive chronic overdose. Diabetic coma is usually precipitated by the patient's failure to take insulin. **** treatment of diabetic coma. Pharmacology for midwives. 151. Mild hypoglycemia relieved by oral administration of CHO's orange juice. In comatose patients, administer 10-30 ml of 50% dextrose solution. IV. Dose. Usually administered SC. NB. Regular insulin is the only preparation that may be administered IV. This route should be used only for patients with ketoacidosis or diabetic coma. Always expressed in units. Dosage is individualized. It is established and monitored by blood glucose, urine glucose and acetone test. Insulin antagonists. 1 growth hormone elevates glucose level and decreases glycogen synthesis. 2 glucocorticoids enhance conversion of protein to glucose. 3 adrenaline decreases insulin release and enhance glucogenolysis. 4 thyroid hormone promote gluconeogenesis. Pharmacology for midwives. 152. 4 invert the vial several times to mix before the material is withdrawn. Avoid vigorous shaking. 5 assist patient for self-administration of insulin. 6 rotate the sites of SC injections to prevent the problem of hypertrophy or atrophy at injection site. 7 allow insulin to remain at room temperature 1 hour before administration. 8 apply pressure for 1 minute. Don't massage since it may interfere with rate of absorption. 9 if breakfast must be delayed, delay the administration of morning dose of insulin. 10 obtain a thorough nursing history from the client/family. 11 if the client has symptoms of hyperglycemia reaction. Have regular insulin available for administration. Monitor client closely after administration. Check blood glucose, urine glucose, and acetone. 12 check for early symptoms of hypoglycemia. 13 assess diabetic more closely for infection or emotional disturbances that may increase insulin requirements. Pharmacology for midwives. 153. 19 provide the client and family with a printed chart explaining symptoms of hyperglycemia, and instructions concerning what to do for each. 20 instruct client that blurring of vision will subside within 6 minutes 8 weeks. 21. Advise client to check vials of insulin carefully before each dose. 22. Regular insulin should be clear, whereas other forms may be cloudy. 1. Insulin injection regular, crystalline zinc insulin, plus rapid-acting insulin. Kinetics. Onset a half minus 1 HRSC 10 minutes 30 mi. Peak 2 minus 4 HRSC 50 minutes 30 mi. Duration 5 minus 7 HRSC 30 minutes 60 mi. Uses suitable for treatment of diabetic coma, acidosis diabetic, or other emergency situations. Dose individualized. Initial 5 minutes 10 units, 50 minutes 30 minutes before meals, and at time. Diabetic acidosis 0.1 units /kg given by continuous IV infusion. 2. Isophane insulin injection and pH. Pharmacology for midwives. 154. Dose SC individualized. Initial 7 minutes 26 units as a single dose, 30 minutes 16 minutes before breakfast. Oral antidiabetic hypoglycemic agents. Several oral antidiabetic agents are available for patients with non-insulin dependent diabetes. Oral hypoglycemic agents are classified as either first or second generation. Generation refers to structural changes in the basic molecule. Second generation oral hypoglycemic agents are more lipophilic and have greater hypoglycemic potency 200 times than first generation. Classification. 1. First generation sulfonylureas compounds such as atobutamide oronase, B-chloropramide, diabinase, C-glybenclamide, dianyl. 2. Second generation sulfonylureas compounds such as glyburide micronase. Pharmacology for midwives. 155. Indication. Non-insulin dependent diabetes mellitus nudum type Roman 2. Patients should be subjected to a 7-day therapeutic trial. Decrease in blood sugar, decrease in glucosuria, and disappearance of polyuria, polydipsia, and polyphagia indicate that patient can be managed on oral antidiabetic agents. Contraindications. Type I of DM. Renal and liver disease. Diabetes complicated by recurrent episodes of ketoacidosis. Side effects. Hypoglycemia most common. Nausea, heartburn, diarrhea. Headache, dizziness, general weakness. Pancytopenia. Chronic use increases risk of cardiovascular mortality. Cholestatic jaundice rare. Nursing considerations. See nursing considerations for insulin. Pharmacology for midwives. 156. Doses more than 750 mg are not recommended. 2. Glyburide. Trade name micronase. Class second generation sulfonylurea. Dose initial 2.5 minus 5 mg daily given with breakfast or the first main meal. Then increased by 2.5 mg weekly to achieve the desired response. 3. Tolbutamide. Trade name oronase. Class first generation sulfonylurea. Dose initial 0.52 g daily, so adjust the dose depending on response. Maintenance 0.253 g daily, not exceed 3 g. 4. Glybenclamide. Trade name Dainil. Class first generation sulfonylurea. Dose a half minus 1 tablet 5 mg daily, increased by 2.55 mg weekly to achieve the desired response. 5. Metformin hydrochloride. Trade name Glucophage. Indications and dosages. Pharmacology for midwives. 157. Action. Improves insulin sensitivity, increases peripheral glucose uptake and use. Adverse reactions. GI, diarrhea, nausea, vomiting, abdominal bloating, flatulence. Anorexia, taste perversion. Hematologic, megaloblastic anemia. Metabolic, lactic acidosis. May decrease vitamin B12 and hemoglobin levels. Contraindications and cautions. Contraindicated in patients hypersensitive to drug and in those with renal disease, hepatic disease, metabolic acidosis, or heart disease. Nursing considerations. 1. Assess patient's renal function. 2. Give with meals. Give once daily dosage with breakfast and twice daily dosage with breakfast and dinner. 3. Monitor patient closely during times of increased stress, such as infection, fever, surgery, or trauma. Insulin therapy may be needed in these situations. 4. Alert. Stop drug immediately and notify doctor if patient develops a pharmacology for midwives. 150. Many slightly modified synthetic variants are available today. Some patients respond better to one substance than to another. These hormones influence many metabolic pathways in all organ systems and are essential for survival. The release of corticosteroids is controlled by hormones such as corticotropin releasing factor produced by the hypothalamus and ACT produced by the anterior pituitary. Corticosteroids have the following effect. 1. CHO metabolism. Deposition of glucose is glycogen in the liver and conversion of glycogen to glucose when needed. Gluconeogenesis. 2. Protein metabolism. The stimulation of protein loss from many organs. 3. Fat metabolism. The deposition of fatty tissue in facial, abdominal, and shoulder regions. 4. Water and electrolyte balance. Alteration of glomerular filtration rate, increased sodium and fluid retention also affect the excretion of potassium, calcium, and phosphorus. 5. Have anti-inflammatory effect. They decrease prostaglandin synthesis. Pharmacology for midwives. 159. 2 mineralocorticoid D, aldosterone and desoxycorticosterone. Increase reabsorption of NO++ water and excretion of potassium and hydrogen. Uses. Therapy with glucocorticoids is not curative and many situations should be considered as adjunctive rather than primary therapy. 1. Replacement therapy, adrenal insufficiency, Addison's disease. 2. Rheumatic disorders, rheumatoid arthritis and osteoarthritis. 3. Collagen diseases, systemic lupus erythematosus, rheumatic cardiac. 4. Allergic diseases, drug hypersensitivity, urticarial transfusion reaction. 5. Respiratory diseases, bronchial asthma, rhinitis. 6. Ocular diseases, allergic and inflammatory conjunctivitis, keratitis. 7. Dermatological diseases, psoriasis, contact dermatitis, urticaria. 8. Diseases of the GIT, ulcerative colitis. 9. Nervous system, myasthenia gravis. 10. Malignancies, leukemia, lymphoma. 11. Nephrotic syndrome. 12. Hematological diseases, hemolytic anemia, thrombocytopenic. Pharmacology for midwives. 160. 5. Congestive heart failure. 6. Hypertension. 7. Hyperlipidemia. Side effects. Prolonged therapy may cause Cushing-like syndrome and atrophy of the adrenal cortex and subsequent adrenocortical insufficiency. NB. Steroid withdrawal syndrome may lead to anorexia, nausea, vomiting, weight loss, headache, myalgia, and hypotension. Side effects include edema, alkalosis, hypokalemia, hypertension, CHF, muscle wasting, weakness, osteoporosis, nausea and vomiting, headache, hypercholesteremia, hirsutism, amenorrhea, depression, increased heart rate, hyperglycemia, and peptic ulcer. Dose highly individualized according to the condition and response of the patient. NB. It is most important that therapy not be discontinued abruptly. Nursing considerations. 1. Administer oral forms with food to minimize ulcerogenic effect. 2. For chronic use, give the smallest dose possible. 3. Corticosteroids should be discontinued gradually if used chronically. Pharmacology for midwives. 161. 10. Instruct the client to avoid falls and accidents osteoporosis causes. Pathological fracture. 11. Remind the client to carry a card identifying the drug being used. 12. Stress the need for regular medical supervision. 13. Advise the client to delay any vaccination while taking these medications weakened immunity. 14. Explain the need to maintain general hygiene and cleanliness to prevent infection. 1. Betamethasone. Trade name Celestone. Class, adrenocorticosteroid synthetic, glucocorticoid type. Additional uses, prevention of respiratory distress syndrome in premature infants. 2. Dexamethasone. Trade name Dexacort. Class, adrenocorticosteroid synthetic, glucocorticoid type. Forms, tablets 0.5 mg, ampule 4 mg, 20 mg. 3. Hydrocortisone. Pharmacology for midwives. 162. Trade name Deltasone. Class, adrenocorticosteroid synthetic. Forms, tablets 5 mg, 20 mg. Asterisk posterior pituitary hormones asterisk. 1-methyl-ergonovine malate. Trade name Medogen. Class, oxytocic agent. Action is a synthetic agent stimulates the rate, tone, and amplitude of uterine contractions. It also stimulates smooth muscles surrounding certain blood vessels by interacting with adrenergic and dopaminergic receptors. Uses. 1. Management and prevention of postpartum hemorrhage by producing firm cervical contractions and decrease uterine bleeding. 2. Incomplete abortion. 3. Migraine headache. Contraindications. Pregnancy. Hypertension. Pharmacology for midwives. 163. Dose. Forms, tablet 0.2 mg, 0.2, 0.4 mg/6 minutes 12 HR for 48 HRS. IV. In emergency situations. 2. Oxytocin. Trade name Pitocin. Class, oxytocic agent. Action. It has uterine stimulant, vasopressive, and antidiuretic properties. Mimics uterine contractions of normal labor. Facilitates ejection of milk from the breast by stimulating smooth muscles. Onset I.B. immediately I.M. 3 minutes 5 minutes. Peak 40 minutes. Duration I.B. 20 I.M. 30 minutes 60 m. Uses: antepartum induction or stimulation of labor. Uterine inertia hypotonic contractions. For induction of labor in case of preeclampsia, eclampsia, maternal diabetes and other conditions. Pharmacology for midwives. 164. NB. Oxytocin should never be given IV undiluted in high concentration. Side effects: tetanic uterine contraction, rupture uterus, hypertension, tachycardia. To fetus, it may cause death, intracranial hemorrhage, brady or tachycardia. Dose: IM or IV infusion for induction or stimulation of labor. IV infusion 10 units 1 ml diluted in 1000 ml of normal saline or 5% dextrose. Initial 0.10.2 units/minute increased by small increments after 15 minutes intervals. Nursing considerations: 1. The physician should be available during administration of the drug. 2. Use wide tubing for IV administration. 1 bottle contain oxytocin in another free. 3. Note any history of hypersensitivity and other contraindications. 4. Check for cervical dilation and uterine contractions patterns. 5. Remain with the client throughout the administration of medication. Pharmacology for midwives. 165. The kidney is a complex organ with 3 main functions. 1. Maintain the acid-base balance. 2. Elimination of waste materials and return of useful metabolites to the blood. 3. Maintenance of an adequate electrolyte balance, which in turn governs the amount of fluid retained in the body. Malfunction of one or more of these regulatory processes may result in the retention of excessive fluid by various tissues. Edema. Edema is an important manifestation of many conditions such as pregnancy and congestive heart failure. Action of diuretics: it increases the urinary output of water and sodium prevention or correction of edema through one of the following mechanisms. 1. Increasing the glomerular filtration rate. 2. Decreasing the rate at which sodium is reabsorbed from the glomerular filtrate by the renal tubules, therefore water is excreted along with sodium. 3. Promoting the excretion of sodium and therefore water by the kidney. Pharmacology for midwives. 166. It inhibits the reabsorption of sodium and chloride in the ascending loop of Henle, resulting in excretion of sodium chloride into a lesser degree potassium and bicarbonate ions. Also, it decreases the reabsorption of sodium and chloride and increases the excretion of potassium in the distal tubule. It has a slight antihypertensive effect. Uses: edema associated with congestive heart failure, liver cirrhosis, nephrotic syndrome, acute pulmonary edema, hypertension. Contraindications: hepatic coma associated with electrolyte depletion, anuria, several renal diseases, hypersensitivity. Side effects. Pharmacology for midwives. 167. Because the drug potentiates the effects of muscle relaxants, it is recommended to discontinue oral medication 1 week before surgery and the IV 2 days before surgery. Forms: tablets 40 mg, ipules 20 mg/12 250 mg/10 ml. Dose: oral 20 minutes 80 mg is a single dose. IP 20 minutes 40 mg is a single dose. For hypertensive crisis, 100 minutes 200 mg. Nursing considerations: 1. When high doses are required, administer Lasix by infusion. 2. Store in a light-resistant container. 3. Monitor serum electrolytes and for signs of hyperkalemia. 4. Observe client for signs of dehydration and circulatory collapse. 5. Monitor pulse and blood pressure. 6. Advise the client to take medication in the morning to avoid interruption of sleep. 7. Discuss the need for a diet high in potassium. Drugs affecting the respiratory system. Pharmacology for midwives. 168. They also have a slight diuretic effect, stimulate gastric acid secretions, and increase the force and rate of the heart. Uses: prophylaxis and treatment of bronchial asthma. Reversible bronchospasm associated with COPD. Contraindications: hypersensitivity, hypotension, coronary artery disease, angina pectoris. Side effects: nausea, vomiting, epigastric pain, rectal irritation following use of suppositories, headache, dizziness, hypertension, arrhythmias, tachycardia. NB. Aminophyline given by rapid IV may produce hypotension. flushing, precordial pain, headache, and dizziness. Overdose. Toxicity is usually associated with parenteral administration and oral. Pharmacology for midwives. 169. Dose individualized. Nursing considerations. 1. Dilute drugs and maintain proper infusion rate. 2. Assess client for any history of hypersensitivity. 3. Obtain baseline blood pressure and pulse prior to starting therapy. Monitor BP and pulse closely during therapy. 4. Observe closely for signs of toxicity. 5. To avoid epigastric pain when administered orally, give the medication with meals. 6. Monitor for serum level of theophylline. 7. Instruct the client to increase intake of fluids to liquefy secretions. Examples. 1. Aminophyline. Class antiasthmatic bronchodilator. Theophylline plus ethanediamine. Action. Relaxes smooth muscles of bronchi, causing bronchodilation and increasing vital capacity of the lungs. Additional use. Neonatal apnea and bradycardia. Forms. Ampule 250 mg/10 ml. Pharmacology for midwives. 117. 2. Theophylline. Class. Antiasthmatic bronchodilator. Trade name Theotrard. Forms. Capsules containing 50, 100, 200, 300 mg. Drugs affecting the GI. 1. Antacids. Action. Antacids act by neutralizing or reducing gastric acidity, thus increasing the pH of the stomach and relieving hyperacidity. If the pH is increased for the activity of pepsin is inhibited. Ideally, antacids should not be absorbed systemically, nor coffee and coffee may produce systemic effects. Antacids containing magnesium have a laxative effect. Antacids containing aluminum or calcium have a constipating effect. Uses. Treatment of hyperacidity. Heartburns. Peptic ulcer. Duodenal ulcer. Gastroesophageal reflux. Pharmacology for midwives. 171. Children less than 6 years of age. NB. Chronic use of aluminum-containing antacids may contribute to development of Alzheimer's disease. Nursing considerations. It is recommended that most antacids be taken at 3 hours after meals and at bedtime. Tablets should be thoroughly chewed before swallowing and followed by a glass of milk or water. Shake liquid suspensions thoroughly before pouring the medication. Clients taking aluminum or calcium-containing antacid shadel. Take 2500 minutes 3000 cc of fluids to prevent constipation. Advise clients to report persistent diarrhea or constipation. Physician. Drugs in this group. 1. Molox. Contents tablet antacids ALOH 200 mg plus MgOH 200 mg. Suspension antacids 225 mg of ALOH plus /5 ml plus 200 of MgOH oil. Pharmacology for midwives. 172. Trade name Zantac, branding ampule 50 mg /Tom. Tapa. 150 300 mg. Plus. HO receptor antagonists. Action. It competitively inhibits gastric acid secretion by blocking the effect of histamine on histamine HO receptors. Uses. Short-term up to 8 WKS and maintenance treatment of duodenal ulcer and treatment of benign gastric ulcer. Management of hypersecretion of gastric acid. Reflux esophagitis. Contraindications. Liver cirrhosis, impaired renal and hepatic function. Side effects. Constipation, nausea, vomiting, diarrhea, headache, dizziness, malaise, vertigo, bradycardia or tachycardia, pancytopnia, rashes, bronchospasm, alopecia. Dose 150 mg 2 times daily. Maintenance 150 mg at bedtime. Nursing considerations. Dilute for IB, use 50 mg and 20 ml of 0.9% NaCl. Pharmacology for midwives. 173. Gastroesophageal reflux disease, esophagitis, duodenal ulcer short-term treatment. To eradicate H. pylori, short-term treatment of active benign gastric ulcer. Action. Inhibits activity of acid proton pump and binds to hydrogen. Potassium adenosine triphosphate at secretory surface of gastric parietal cells to block formation of gastric acid. Dose 20 minutes 40 mg daily for 4 minutes 8 weeks. Side effects. CNS headache, dizziness. GI diarrhea, abdominal pain, nausea, vomiting, constipation. Flatulence. Musculoskeletal back pain. Respiratory cough, upper respiratory tract infection. Skin rash. Contraindications and cautions. Contraindicated in patients hypersensitive to drug or its components. Pharmacology for midwives. 174. Caution patient to avoid hazardous activities if he gets dizzy. Glycerin suppositories. Plus miscellaneous laxative. Action: promote defecation by irritating the rectal mucosa as well as hyperosmotic action. It also softens and lubricates fecal material. Onset 50 minutes 60 minutes. Uses: to evacuate the colon prior to rectal and bowel examination or surgery. To establish normal bowel function in patients dependent on laxatives. Contraindications: anal fissure, fistula, ulcerative hemorrhoids. Antiemetics: nausea and vomiting can be caused by a variety of conditions such as infections, drugs, motion, organic disease, or psychological factors. The underlying cause of the symptoms must be elicited before emesis is corrected. The act of vomiting is complex. The vomiting center in the Pharmacology for Midwives. 175. Many drugs used for other conditions such as antihistamine, phenethazines, and barbiturates have antiemetic properties and can be so used. Drug interaction. Because of their antiemetic and antinosant action, the antiemetics may mask overdose caused by other drugs. Nursing considerations. 1. Take a complete history if it is an unusual occurrence or if it is a recurring phenomenon. 2. Assess for other untoward symptoms as increased intracranial pressure or intestinal obstruction. Antiemetic may mask signs of underlying pathology. 3. Caution the client that drug tends to cause drowsiness and dizziness. Advise him / her to avoid hazardous tasks. Metoclopramide HCl. Trade name: Pramin. Class: antiemetic. Action: it is dopamine receptor antagonist, acts both centrally and peripherally. Centrally due to the effect in the CTZ inhibition. Peripherally, it stimulates the motility of the upper GIT without. Pharmacology for Midwives. 176. 1. Digestive disorders leading to relief: GIT pain, dyspepsia, and regurgitation in peptic ulcer, reflux esophagitis, and post-anesthetic vomiting. 2. Nausea and vomiting as in chemotherapy. 3. Facilitate diagnostic procedure, e.g., barium meal. Side effects: GI disturbances, transient hypertension, supraventricular tachycardia, dizziness, and extrapyramidal effect convulsion. Forms: ampule 10 mg/12 ml. Ampule 50 mg/10 ml. Tablet 10. Syrup 500/5 ml. Suppository 20 adult, 5 in children. Dose: -10 mg, 30 minutes before meal and at bedtime. For chemotherapy, 2 mg/kg, 30 minutes before chemotherapy. Contraindications: seizure, epilepsy, pheochromocytoma, intestinal obstruction. Nursing considerations: 1. Don't give Pramin to patients with epilepsy, pheochromocytomes, or patients with intestinal obstruction. 2. Administer oral medication 30 minutes before meal and at bedtime. 3. Administer IV injection slowly over 1 minute 2 minutes. Pharmacology for Midwives. 177. Thyroid and antithyroid drugs. The thyroid manufacturers. 2. Active hormones: thyroxine and triiodothyronine, both which contain iodine. Diseases involving the thyroid fall into 2 groups. 1. Hypothyroidism, decreased thyroid hormones. Cretinism in infancy and early life. Myxedema in adult. Cretinism leads to decreasing in physical and mental development. Myxedema causes dry swelling, edema, non-pitting. Primary results from atrophy of the thyroid and secondary as a result of hypofunction of pituitary gland or prolonged administration of antithyroid drugs. 2. Hypothyroidism, increased production of thyroid hormones. Graves' disease characterized by protruding eyes and extreme nervousness. Thyroid hormone preparations: levothyroxine sodium T4, Synthroid, levothyronine sodium T3, Cytomel. Pharmacology for Midwives. 170. 1. Essential for normal physical and mental development of the fetus and infants. 2. Increase the BMR and blood sugar level, increase synthesis of fatty acids, and decrease plasma cholesterol and triglycerides. 3. Increase HR and peripheral resistance. 4. Decrease thyroid-releasing hormone TRH and TSH from the hypothalamus and anterior pituitary. Indications: replacement therapy in primary and secondary myxedema, non-toxic, goiter, and chronic thyroiditis, with erotothyroid drugs for thyrotoxicosis to prevent hypothyroidism. Surgical removal of thyroid gland. Contraindications: uncorrected adrenal insufficiency, and hypothyroidism. NB. Should not be used to treat obesity or infertility in either males or females. Pharmacology for midwives. 179. Others: menstrual irregularities, hyperthyroidism, sweating, allergic reaction, hyperglycemia. Nursing considerations. 1. The treatment is initiated slowly with small doses and gradually increased. 2. Store medications in cool dark place. 3. Take complete nursing history. 4. Note if the client is taking antidiabetic drugs and document. 5. Take baseline ECG, then at regular intervals. 6. Monitor thyroid function closely. 7. Observe client for side effects. 8. Monitor PT and PTT closely since the drug increases hypoprophthrombinemia. 9. Monitor HR and BP closely for cardiac patients. 10. Instruct the client to report side effects c.g. weight loss and nervousness to physician. 11. Have dietitian counsel clients regarding diet according to the energy demands. 12. Female client should record menstrual irregularities. Pharmacology for midwives. 180. ANTB. Since these agents don't affect release or activity of performed hormone, it may take several weeks for the therapeutic effect to become established. Uses: hyperthyroidism, in preparing the patient who must undergo surgery or radioactive iodine therapy. Contraindications: lactation. Side effects: loss of taste, enlargement of salivary glands, thrombocytopenia, leukopenia, agranulocytosis, skin rash, and hypoprophthrombinemia. Examples: 1. Methimazole-tapazole is 10 times stronger than PTU. 2. Propyltyrosol PTU. Oral contraceptives. Estrogen-progesterone combinations. The most effective form of birth control available. Pharmacology for midwives. 181. 3. Triphasic. The estrogen content may be the same or may vary throughout the medication cycle. The progestin content varies. NB. The purpose of biphasic and triphasic products is to give or provide hormones in a manner similar to that occurring physiologically. Other types of oral contraceptives is the progestin-only mini-pill product, which contain a small amount of progestin in each tablet. Action: inhibit ovulation due to inhibition of LH and FSH by negative feedback mechanism which are necessary for development of the ovary changes in the endometrium and cervical mucosa so that the penetration of sperm and implantation of ova will not take place. Promote the regularity of the cycle. Decrease incidence of dysmenorrhea. Decrease blood loss during menstruation. Decrease incidence of endometrial cancer, ectopic pregnancy, and pelvic inflammatory diseases. Uses: contraception. Menstrual irregularities. Pharmacology for midwives. 182. Side effects: hypertension, weight gain, oily skin, hirsutism, headache, nausea, dizziness, breast tenderness, increase in breast size, anxiety and decrease in menstrual flow, decrease the quantity and quality of breast milk. Nursing considerations: 1 tablet should be taken approximately at the same time each day, with meal or at bedtime. 2. Spotting bleeding may occur 1-2 first days of the cycle. If continue, notify the physician. 3. For the 21-day regimen, tablet is taken daily beginning on day 5 of the cycle. No tablets are taken for 7 days. 4. For the 28-day regimen, tablets are taken for the first 21 days, following by 7 days of iron-containing tablets. 5. If a woman fails to take 1 or more tablets, the following recommendation should be followed. If 1 tablet is missed, it should be taken as soon as it is remembered. Alternatively, 2 tablets can be taken the following day. Pharmacology for midwives. 183. 7. Advise the client prior to initiate therapy that there is a high risk for cancer of breast. 8. Instruct client to avoid smoking. 9. If a woman is breastfed, instruct her to find other form of contraception. ANTB. H system, pill danger signs. A equals abdominal pain severe. C equals chest pain severe or shortness of breath. H equals headache severe. E equals eye problems, loss of vision, blurred vision. S equals severe leg pain, calf or thigh. Generic name, metoprolol acetate. Shared name, Depo-Provera. Classification, hormone. Pregnancy risk category X. Available forms: tablets 2.5 mg, 5 mg, 10 mg. Injection suspension 150 mg/ml, 400 mg/ml. Pharmacology for midwives. 184. Suppresses ovulation, possibly by inhibiting pituitary gonadotropin secretion, thus preventing follicular maturation and causing endometrial thinning. Adverse reactions: CNS, depression, CVA pain. CV, bronchophlebitis, pulmonary embolism, edema, thromboembolism. GI, abdominal pain. Goo, bleeding, dysmenorrhea, amenorrhea, cervical erosion, abnormal secretions. Hepatic jaundice. Metabolic weight changes. Skin, rash, sterile abscesses, acne, pruritus, alopecia, hirsutism. Other, breast tenderness, enlargement, or secretion. Contraindications and cautions. Contraindicated in patients hypersensitive to drug and in those with active thromboembolic disorders or history of thromboembolic disorders, cerebrovascular disease, breast cancer, missed abortion, or hepatic dysfunction, also contraindicated during pregnancy. Tablets are contraindicated in patients with liver dysfunction or known or suspected. Pharmacology for midwives. 185. Monitor patient for pain and swelling, warmth, or redness in calves, sudden, severe headaches, visual disturbances, numbness in extremities, signs of depression, signs of liver dysfunction, abdominal pain, dark urine, jaundice. Advise patient to take medication with food if GI upset occurs. Alert, tell patient to report unusual symptoms immediately and to stop drug. And notify doctor about visual disturbances or migraine. Teach women how to perform routine breast self-examination. Advise patient to immediately report to doctor any breast abnormalities. Vaginal bleeding, swelling, yellowish skin or eyes, dark urine, shortness of breath, chest pain, or pregnancy. Advise patient that injection must be given every 3 months to maintain adequate contraceptive effects. Generic name, Rho-D immune globulin. Trade name, Rogam. Indications administered to Rh-negative women who have been exposed to Rh-positive blood by delivering and Rho-D-positive infant, aborting and Rho-D-positive fetus, having chorionic villus sampling, amniocentesis, or intra-abdominal. Pharmacology for midwives. 186. Fetus/newborn erythroblastoses fetalis in future pregnancies of women who have conceived in Rho-D-positive fetus. Contraindications and precautions. Contraindicated in Rho-D-positive patients, patients previously sensitized to Rho-D. Adverse reactions and side effects, pain at IM site. Route and dosage. 1 vial standard dose 300 mcg administered intramuscularly. At 28 weeks of pregnancy and within 72 hours of delivery or abortion. Nursing implications. 1. Do not give to infant to Rho-D-positive individual or to Rho-D-negative individual previously sensitized to the Rho-D antigen. Note: there is no more risk than when given to a woman who is not sensitized. If in doubt, administer Rho-D immune globulin. 2. Administer into the deltoid muscle. Should be given within 3 hours, but may be given up to 72 hours after delivery, miscarriage, abortion, or transfusion. 3. Explain to the patient the purpose of this medication to protect future Rho-D-positive infants. Pharmacology for midwives. 187. Reduces gastric acid secretion and increases gastric mucus and bicarbonate production, creating a protective coating on gastric mucosa. It works on uterus to induce uterine contractions. Availability. Tablets, 100 mcg, 200 mcg. Indications and dosages. To prevent gastric ulcers caused by NSAID. Adults 200 mcg q.i.d. with food. Induce labor, cervical ripening. Intravaginally 25 mcg repeated every 4-6 hours. Incomplete and therapeutic abortion. Contraindications. Black circle prostaglandin hypersensitivity. Black circle pregnancy. Use in pregnancy can cause abortion, premature birth, or birth defects. Precautions. Administration. Before starting therapy, make sure female patient understands dangers of taking drug while pregnant or breastfeeding. Pharmacology for midwives. 188. Black circle monitor menstrual pattern or postmenopausal bleeding. Report significant problems. Black circle instruct patient to take drug with food. Black circle advise patient to report diarrhea, abdominal pain, and menstrual irregularities. Tell patient drug may cause spontaneous abortion. Black circle caution patient not to take magnesium-containing antacids, which may worsen diarrhea. Dinoprostone, prostaglandin net or PG et al. Cervidil vaginal insert, propidil. Endocervical gel, propras, prostin. Epivaginal suppository. Class oxytocic, prostaglandin. Pregnancy risk category C. Action. Initiate strong contractions of uterine smooth muscle by stimulating myometrium and promoting cervical softening, effacement, and dilation. Indications and dosages. Pharmacology for midwives. 189. Contraindications. Black circle hypersensitivity to prostaglandins. Black circle ruptured membranes, placenta previa, or unexplained vaginal bleeding. During pregnancy. Precautions. Use cautiously in pulmonary, cardiac, renal, or hepatic disease, asthma, hypotension, adrenal disorders, diabetes mellitus, epilepsy, multiparity. Administration. Black circle keep patients supine for 15 to 30 minutes after gel administration and for 10 minutes after administering suppository to prevent drug expulsion. Black circle store suppositories in freezer, bring to room temperature before using. Adverse reactions. CNS headache, drowsiness, syncope. CV, hypertension. GI, nausea, vomiting, diarrhea. U, urinary tract infection, vaginal or uterine pain, uterine contractile. Abnormalities, warm vaginal sensation, uterine hypertonicity, uterine rupture. Musculoskeletal, back pain. Respiratory, cough, dyspnea, wheezing. Pharmacology for midwives. 190. 5. Evaluate for GI upset. To minimize, give antiemetic before. Dinoprostone therapy. 6. Advise patient to stay in supine position as prescribed after administration. Tetanus toxoid. Class tetanus prophylaxis / vaccine. Tetanus toxoid for intramuscular use is a sterile suspension of alum, precipitated toxoid in an isotonic sodium chloride solution. The vaccine, after shaking, is a turbid liquid, whitish-gray in color. Action: active immunization against tetanus. Uses: tetanus prophylaxis. Caution: down error immune response if given to PTS taking corticosteroids or immunosuppressive drugs. Side effects: local erythema, sterile abscess, chills, fever, neurologic disturbances. Nursing considerations. 1. Stress the need of timely completion of immunization series. 2. Given IM never room 4 as it is a suspension. Trade name OM-3. Pharmacology for midwives. 191. Contraindication: hypersensitivity to components. Generic name terbutaline sulfate. Trade name Bricanyl monovant. Pharmacologic class: selective beta-adrenergic receptor agonist. Therapeutic class: bronchodilator. Pregnancy risk category B. Action: relaxes bronchial smooth muscle by stimulating beta-adrenergic receptors. Inhibits release of hypersensitivity mediators, especially for mast cells. Indications and dosages. Bronchospasm in reversible obstructive airway disease. Tocolytic in preterm labor. Contraindications. Black circle hypersensitivity to drug. Precautions. Use cautiously in black circle cardiovascular disorders, hypertension, arrhythmias, hypothyroidism, diabetes mellitus, seizure disorders. Black circle elderly patients. Pharmacology for midwives. 192. Patient monitoring. Black circle monitor vital signs. Black circle assess neurologic status. Patient teaching. Black circle tell patient he may take with or without food. Black circle advise patient or parents to establish effective bedtime routine to minimize insomnia. Black circle instruct patient or parents to space doses evenly during waking hours to avoid taking drug at bedtime.